Bigger, better, bolder. The cold, hard truth is taking talk to the next level. Right here on Bobo 89.1 FM, Cayman's Community Radio. We are still spilling the tea and committed to being part of the change that Cayman so desperately needs. Join Sandy Hill weekdays from 7:30 a.m. for Premier Access, Cayman Voices, Truthful Thursdays, and much more. Cayman's #1 talk show is now bigger, better, bolder, and more than talk. Getting results with hot topics, consumer reports, court exposés, and more.
I've come to set the record straight. I've come to shine the light on you. Let me introduce myself. I am the cold, hard truth.
Now, from the CMR studio in Grand Cayman, live, direct, it's the cold, hard truth. Now, join the conversation on 345-936-2626.
That number again is
345-936-2626.
Good morning, Cayman. How is everyone doing this beautiful Tuesday morning? Hope that you guys are having a fantabulous week so far. Of course, Tuesdays, Medical Rundown Tuesdays. So we're going to be talking about MS today, which is, believe it or not, quite an interesting subject. We've discussed this previously. We even had an MS patient join us on the program, talking about how she tries to, after being formally diagnosed, she tries to balance her life with this disease. It's manageable with good medical assistance. And so, of course, we have here today Health City, who is going to be helping us to navigate this very, very important topic. So let's go ahead and welcome Mr. Shamari Scott. Good morning, Shamari. How are you?
Good morning, Sandy. How are you doing?
We're good. We're good here in the studio.
Just in the nick of time. Marlon's the IT person, right?
Oh, yeah.
I'm the IT guy's worst nightmare. So when you always get the prompts to update your computer and you always put it next 2 hours, next 2 hours, next 2 hours.
Yes.
Yeah. I did that for probably 1 week until this morning. It was like, yeah, I'm not going to allow you any sound until you actually do the restart and download. So just in the nick of time, I'm here.
Aye. No worries.
So he and Steven can sit and have beers and talk about, those IT guys that, give all of the issues, those employees that
drive them crazy. That would be you.
That would be me. I raised my hand. But excited to be here once again. And I don't know if you know, but May 30th is World MS Day. Mm-hmm. And that's why we have two of our consultants that are going to join us today to discuss what is MS, the causes, symptoms, the impacts, the importance of early diagnosis, as with anything else, but also this specific disease profile. And, reducing diagnostics delays and barriers are part of what they want to highlight with MS Day, and also empowering patients through awareness, which is one of the main reasons for the show, right, Sandy?
Absolutely.
So today we have, and I know you'll let them in shortly, we have Dr. Romnish, who's our consultant interventional neurologist, has multiple decades of experience. I know he doesn't look that way. He looks quite young, even though, I tease him at times that he looks like he could be my father, but he still has multiple decades of experience. And just because we haven't kept up with it, but as of a year and a half ago, he was the only interventional neurologist in the region.
Oh, wow.
which does some special things. That's a topic for another day where we talk about time is brain, and if you're having a stroke, to get to us within the golden hours. And Dr. Romnish has the capabilities of going in minimally invasively and actually removing the clots and reversing the impacts of a stroke if it's a specific type of stroke. But that's a
Mhm.
conversation for another day to speak about Dr. Romnish in that context. But definitely want to welcome
Mm.
Dr. Romnish to the program.
Good
Um,
morning.
Morning, Sandy. Morning, Shumari.
Yes,
Thanks
thank
for
you
having
so
us
much.
back again.
and,
Absolutely.
and also Dr. Susant, who has over a decade of experience, is a consultant neurologist as well with Health City. And as you know, we always build out our teams to have the best teams possible in Health City. And he has, as I mentioned, over a decade of experience. And something that's interesting as well is that he was also a part of a robust clinical and academic team with multiple publications that included subspecialties of clinics in stroke, movement disorders, epilepsy, and MS that we're also discussing today.
Morning, Sandy. Morning,
Good
Dr.
morning.
Sandy.
Good morning,
Morning,
doctors. Wow.
morning.
Fantastic. So we've got a really good discussion today. And like I said, you hear about this disease of MS and you think, well, I don't know anybody with that. And I think, hold on a second, maybe you don't know that they're living with it. But I know here in Cayman, I actually know quite a handful of people that do have MS. So this is a really important day because one of the things that we know is you will have your team of professionals like Dr. Susant and Dr. Ramnish, but you also need support of family and the community. Like if someone says, well, I have an MS diagnosis, it would be good to not try to put them in a box thinking that, oh, well, they're not going to be able to live a fulfilling life. No, the doctors are here to tell you that if you have good treatment options, that you can live a very fulfilling life, and you've just got to make sure that you stay on top of your diagnosis. So let's talk about exactly. Let me pull up our slides here. But Doc, let's talk about exactly what MS is, because I know it's something that sometimes is easy to diagnose, and it takes a while, perhaps, for someone to get the proper diagnosis. And as we always say, time is normally of the essence when it comes to treating any sort of disease profile, as Shamari rightfully said.
Yeah, absolutely. So, multiple sclerosis is a neurological disorder which affects the central nervous system. The central nervous system basically comprises of your brain and spinal cord. What happens in MS is the body starts attacking the myelin sheath, which is around the nerves. Due to this attack on the myelin sheath, it basically interrupts the smooth transmission of impulses from the nerves to other parts of the body. To give you a simple example, if you can picture a normal electrical wire, if the coating around the wire is destroyed, then the electrical impulses will not transmit through the wire. So it's something similar which happens in multiple sclerosis, which is an autoimmune mediated attack against the central nervous system.
Wow. So it's almost like your body is essentially attacking itself?
Absolutely, yes.
Yeah. Wow. And I'm thinking again of the people that I know with this diagnosis. And one young lady, she's actually been on the program before. She has hers, I think, under pretty good control. But when you see someone with MS, a lot of times, you can't necessarily look at them and tell that they have MS. So is this something that you find the community needs greater education on, generally speaking?
Yes, see, MS for medical professionals also is referred to as the great chameleon, or something which mimics so many other conditions. It
Mm,
may present with trivial symptoms such as mild headache, mild visual blurring, a transient doubling of the vision, which recovers on its own. So many of these attacks initially have a spontaneous recovery. So patients many times do not seek medical intervention because they feel a symptom has come and it's
mhm,
gone its own, so probably it was not significant. And
mhm,
by the time they seek attention, it's already progressed in the brain. So
mhm,
many of these lesions are silent, which can be picked up in an MRI. And when we do an MRI, probably we see multiple regions. So a general knowledge about the disease, the cardinal symptoms with which it can manifest very subtly in the initial stages, and its affects specifically in the younger age group. So it has a large impact on the whole life. So making generally people aware, school children, college kids, about the symptoms so that seek attention at the earliest is the key, I think.
Yes, absolutely. Well, thank you so much for that. And let's move back just a little bit because, as Shamari said, we are having this discussion today because every year multiple sclerosis is celebrated on May the 30th, raising global awareness, I should say, about this. And it's being led by the MS International Federation. And so this really brings the global MS community together to share their stories, raise awareness, and advocate for change. And of course, the ultimate goal is to really try to improve the quality of life for anyone who finds themselves having to deal with an MS diagnosis. So, folks, I'm sure you know people in your life who have this, and it can touch people of all ages. We'll talk about what the sort of average profile might look like, but it could really be anyone. And the theme this year is My MS Diagnosis, with the tagline of Navigating MS Together. So, really just focusing on the journey to a diagnosis and a lot of the challenges that many people face getting there. As Dr. Susant just said, oftentimes it takes a while to even get a proper diagnosis because this disease is a bit tricky and that it can mimic a lot of different things. So we will talk about, Siobhan is already asking, well, what are some of the symptoms? We're going to get there, Siobhan, so that people can pay attention and see how best they can get an early diagnosis. And of course, delayed diagnosis continues to be a global issue all over the world. And some people actually go undiagnosed properly for many, many years, which, delays effective treatments that they might have available to them. Is there a definitive test for MS, doctors?
So yes, so MS, you have to undergo a series of tests to confirm the diagnosis. It starts with first the clinical symptoms which the patient would be experiencing. As Dr. Susan said, there could be some trivial symptoms. Sometimes patients develop double vision, loss of vision, things like that. There could also be sensory symptoms like tingling, numbness. Sometimes it could be cognitive issues as well. MS is generally a disease which affects younger people. So, and the definitive test would be an MRI of the brain and the spinal cord. What you're basically looking for is demyelinating plaques, which show up as white spots on the MRI. Further confirmation can be done with a procedure known as a spinal tap, where we look for abnormal proteins within the spinal fluid or the CSF. This is to help support the diagnosis of MS. The patient will also undergo a battery of other blood tests to rule out MS mimics, just to make sure we're dealing with MS and nothing else.
All right, very good. So let's get into a bit more of the details here. Shamari, looks like you're jumping in and out. You okay? Oh, the tech
Yeah.
issues.
One of those mornings. I'm back.
Yes, I feel you. All right. So again, the campaign 2025 around this year's theme is really aimed to raise awareness about the early signs of MS, to empower people to seek help and persist through the process, and to push for better access to neurologists, MRI scans, and specialized care. And also to break down the stigma and encourage open conversations about MS symptoms. So I think all of these are quite critical. As you rightfully said, if this is a disease that's mimicking a lot of other things, and sometimes it's difficult to come to a proper diagnosis, which can be delayed for years, really paying attention to the early warning signs and getting in to see a neurologist as soon as possible could literally save you years of being tormented by not knowing, what it is that you have. So critical indeed. Let's talk about an early diagnosis and what people need to know when it relates to, trying to identify this as early as possible. So, Siobhan, to answer your question, if doctors now are going to talk about some of these symptoms that we have here. I mean, the first one, my gosh, feeling extremely fatigued. I'm sure every mother and probably some fathers right now are going, "Well, I feel that every day, Sandy." Is there a different type of fatigue? It says extremely fatigue. What do we mean by extremely fatigue? Is this where you can't even get up in the mornings? What are we talking about here?
Yeah, definitely it is something which is the fatigue which is totally out of proportion to your normal life cycle. It's suddenly there is a deterioration. You are pretty active in your life, doing your school work or your college work, in your the sports activities, but suddenly you feel that you have no energy even to get up from the bed and go about your daily activities. Now,
Mm-hmm.
this can be very non-specific, and it's difficult to straight away go to a diagnosis of MS from fatigue. But yeah, it is one of the cardinal features which can the patients can present with. Unfortunately, there are a lot of causes, both medical as well as psychological, which can lead to chronic fatigue syndromes like stress. But that's why many times this can be a feature which is missed in many patients. But what I would like everybody to be aware of is
Mm-hmm.
any transient vision loss, which can be a very prominent presenting features, which the patient suddenly is okay, but he sees his vision going away in one of these eyes, and over a period of a day or a few hours, it comes back. That is something very significant, and it's something which should never be ignored. If you have such a symptoms of a transient visual blurring, especially in one eye, then you should seek attention of a doctor. Any symptoms where there's unilateral, when on half of the body you feel any numbness or tingling sensation, you have any slurring of speech or any doubling of vision, this is something which is should be ingrained, and the knowledge should be spread among the young community to be aware of.
Mm-hmm. Yes. Um, Now, what's the average age of someone with an MS diagnosis? I mean, it sounds like when you're talking about, schoolwork and university, sounds pretty young. Are we talking about people in their early 20s or even younger?
Yes, so MS typically is a disease which affects younger people who are in the most productive years of their life.
Mm,
So the average age would be around 30 to 35. It tends to affect females more than males.
mhm,
And also, it seems to be a disease which, as you move away from the equator, the prevalence of MS seems to be more. So countries like Canada, etc., seem to have a higher incidence of multiple sclerosis.
wow, that's so interesting. So, I mean, it almost sounds like it steals your youth from you. That's kind of sad in a way when you think about it, right?
Yeah.
Some additional symptoms.
Yeah, feeling like imbalance, because it can affect the part of the brain that controls your balance.
Mm-hmm.
Damage to the peripheral nerves of the spinal cord can lead to spasms in the back or the neck. More along, the bladder control is from the nervous system also. So many times patient can present with bladder symptoms like what we typically refer to as urgency. When you have a need to pass micturate, you cannot control it, and you just have to rush to the washroom, and sometimes even then you can't control it. So that is classically what we refer to as a neurogenic bladder symptom. So if you develop urinary urgency, that's most likely due to a background of a neurological conditions. So these are some of the varied symptoms that which MS can present, and it's important to seek attention now because a lot of treatment options available now. I think we'll discuss
Mm-hmm.
that.
Wow. So numbness, tingling, different parts of the body, feeling unbalanced, dizzy, clumsy, uncoordinated, muscle cramps. Now, you said that sometimes symptoms will present themselves and then they kind of recess, if you wish, to say it that way. But so you can have the vision issues present themselves and then they kind of disappear on their own.
Yes, so that typically the MS symptoms can come and go, they can fluctuate. So sometimes you may have a loss of vision which restores itself and the patient is normal again. You can have these transient symptoms of numbness, tingling, feeling of imbalance, etc., which again can be transient. Um, yeah, so symptoms can come and go, and also there's several subtypes of MS, and depending on the type of MS the patient has, the symptoms may either persist or may disappear.
Mm-hmm. Hmm. Well, that makes sense on why it can be difficult for an individual to even pinpoint, well, something really is going on here. Because I suppose, if you have numbness and tingling, you can attribute that to so many different things. And then if it disappears, you go, oh, well, it was really nothing much to worry about. And you try to carry on with your life. Yeah, so incredibly interesting. So you also potential problems with memory or concentration. How do those types of issues tend to manifest themselves?
Yeah, memory issues and concentration issues are usually seen in little advanced multiple sclerosis. Once
Ah,
that the damages keep on accumulating, your brain functions kind of slow down, or your memory kind of gets gives away. Initial manifestations are a little less likely. It's something that we are looking at now more progressively, because we have a lot of pool of patients who
mhm,
are entering the elderly age group. We have which who have significant memory issues compared to a normal individual. That is, we were
mhm,
attributing to gradual accumulation of brain damage, which happens over recurrent attacks of multiple sclerosis. That's how it progresses. There's one attack, it recovers, there's another attack. So, with every time, some amount of tissue is lost. So, your
mhm,
cognitive functions gradually decline over a time. So, this is something which we see later on in patients with MS, not in the early
mhm.
stages.
Not in the early stages. I see. So you talk about the fact that symptoms can flare up and then they relapse and they can even go into remission. So I know the young lady that we spoke to a few years ago about her diagnosis. It seems like she was in a stage of remission. So let's talk about this concept, because normally when people think of remission, like one of the big things is like, oh, cancer. If cancer goes into remission, that means that it's gone and you don't expect to have to deal with it again. Is that how MS operates when it's in remission?
So when a patient is in remission, they can be completely symptom free, or they may have mild residual symptoms. MS has around 4 to 5 subtypes. The most common type is what is called as relapsing remitting MS. So what that means is you will have relapses, and the patient will have significant symptoms, and after that, the patient, after treatment with usually steroids, will reach back to their baseline.
Mm,
So this is the most common type of MS which we see. The aim of treatment of MS is to reduce the number of relapses and to reduce the damage to the myelin sheath in the brain.
mhm, hmm,
So
mhm,
basically, MS is an autoimmune condition. It's basically a condition in which your body's own immune system is acting against you.
mhm,
And an attack is usually initiated when the body's immune system identifies a foreign antigen, which may be a common virus or a bacteria which is causing you a cold or a loose motion, and it produces a batch of antibodies which are defective, and they attack your body proteins instead of the virus or the bacteria. So
mhm,
that's how the attack happens. So it happens in episodes. There is a trigger, the body produces a set of antigens which react against your own body rather than the foreign antigen. It produces the symptoms, and when the antigen is gone, the antibody production
mhm,
becomes low, and the body heals on itself. So the symptoms can be transient. So there was an attack, the antibody production goes down, the body.
mhm,
So that's why this relapsing course will have one attack. It's okay for a few days. You don't know when the foreign antigen is going to again attack the subset of bad antibodies. So that's how it happens. It happens in
mhm,
episodes over a period of years.
mhm. Very good. I see Miss Lucille joining us from the UK, asking if we're talking about MS. Yes, ma'am. We sure are. As the 30th is National World MS Day. And so we are, of course, are educating the people of the Cayman Islands about this disease. So when you say that there are 40 something different types of like subsets of this, that sounds like a lot.
No, sorry, four different types.
Oh, four. Oh, my
Four.
apologies. I thought I heard 40 something.
No,
Okay.
no.
Four. Got it. All right. Okay, not so bad, because I was thinking, my gosh, how do you guys keep up with that? So it's treatable. It's not something that you can ever cure once you have it.
No, it's not curable. It is treatable, and there are medications available to keep it in remission. The medications have improved drastically over the years, and patients who are on treatment have shown very, very good results. They do not happen to show any radiological progression. So every patient with MS will undergo an annual MRI of the brain and the spinal cord. What we are looking for is if there's any radiological evidence of disease progression. Are we seeing more of those white spots within the brain as compared to the previous MRI? We will also look at the patient clinically, whether they're showing any kind of new symptoms, etc., to decide whether the medication is working or not. Currently, there are several medications available which are very, very effective for controlling MS.
Okay, so we're going to talk about treatments here. And again, these treatments have the possibility of actually slowing the progression of the disease. Is this a disease that eventually, I mean, does it eventually kill you, or what's the end stage? What does that look like?
It's a disease which leads to more of a disability than directly causing death. Like I said, with every attack, some part of the body is damaged. You might develop weakness in your arm, you might develop imbalance, which prevents you from walking properly. You need support for your gait. You might suffer from vision loss. So, with time, these deficits accumulate and it adds to the morbidity. It makes your life more difficult. Death as a direct result of the disease is unlikely. It's due to secondary complications like infections, which usually lead to death. So, with the drugs that we have now, of course, we are able to control the intensity or the severity of the attacks over a period of time. But unfortunately, we have to take them continuously for a long duration. Exactly when we can stop, it's a still long debate on it. But yeah, probably we are looking at a scenario maybe later on in life, we can at least reduce or stop in some cases this medication.
All right, so folks, the aim of treatment then in early diagnosis is to slow the progression of the disease so that you can live as normal life as possible and improve the overall quality of your life. So there is a type of treatment, disease modifying therapies, and apparently these are the most effective. So what are disease modifying therapies?
So these are therapies which help preventing further attacks against to reduce the number of autoimmune attacks which take place. So these are disease modifying therapies. There's several different medications available. Some of them you have to take once every 6 months, and there are newer and newer medications coming onto the market which are very, very effective.
Very good. Missy says, thanks, Doc. She's joining us from the UK this morning as well. So again, some of the barriers, we've already talked about the barriers to diagnosis, including the fact that the symptoms vary and mimic other conditions. And there's a lack of awareness amongst the public and non-specialist healthcare providers. They can perhaps miss a lot of this. And this is why, again, folks, shows like this, are really, really important, because if you see something in a family member, a young person, you might think to yourself, let us look into this a little bit more and maybe try to see a specialist like a neurologist to get a better idea of what is going on. Another barrier to diagnosis is access to care, which means that there are people all over the world. Now, I know Cayman has an amazing, sort of health community, and we have a lot of specialists here. Thanks to Health City, we've had specialists here that we've never even had on island before. But there are other people in the world, in some of our neighboring countries, who don't have access to the type of technology, the type of specialist care, and definitely not the specialists themselves. So access to care can be limited for some people, including limits to neurologists, specialists, and MRI imaging equipment, especially in rural or under-resourced areas. And there's also the social stigma, which a lot of people, might prevent them from getting a proper diagnosis and speaking up, because they're fearful of the fact that people, they just hear MS and they think, oh my gosh, you're not gonna you're gonna be in a wheelchair. You're not gonna do anything come next week. So it's really also about educating people to remove the fear and misunderstanding that comes with this diagnosis as well. So let's talk about how we can move forward and really help communities such as the Cayman Islands to be more educated. And that's always the first one on the list is education. So promoting public and professional awareness of early MS symptoms, which hopefully we've done a little bit of this morning. And also training. I think this is important. So when you're talking about training, you're talking about primary care providers because a lot of times people don't get to the two of you, Dr. Ramnesh and Dr. Susan, until much later on. It's like a referral system. Like, oh, you don't need to see a neurologist until a primary care physician or a GP recommends you. So, what is being done in the medical profession for GPs to hopefully recognize some of these symptoms earlier on as well?
I guess presently most of the GPs are pretty aware. They are very sensitive to MS now, and they're pretty qualified to recognize the symptoms. And usually we get good referrals from the GPs here. As a part of curriculum, MS has been given much more importance. So there is a lot of MS in our training. The evolution of MS has been one of the key factors in the medical science now, with the evolution of investigative methods and treatment. So I think generally GPs, we have just talks with the GPs and the locally of making them more aware. But I guess pretty much they are aware of the conditions, and they are good at picking up the early symptoms and referring them to the neurologists.
Very good. And it's wonderful to hear that because, of course, like I said, they're normally the first line of contact that a lot of patients will have when they, just go to the doctor. This is some of the stuff that I'm feeling. And then advocacy. So pushing for faster referral pathways and affordable diagnostic services. Now, I know that, of course, Health City always tries to make medical access to medical, diagnosis and professionals as affordable as possible. Shamari, the MRI equipment that's needed in particular for assisting in diagnosing this particular disease, is it available at both of your Health City Cayman Islands locations?
Yes, yes, it is. Yes, it is. And also to mention that even for the general public, we do lunch and learns within companies and and Dr. Susant and or Dr. Bromnish at times would be available for that. And that's across the board, that we always want, the general community, and the ways to reach them in larger numbers are typically to go to their offices themselves. So we also do that to try and get education out there. However, definitely to answer your question, have the MRIs in both locations. And our physicians are, depending where you are, we make them available in both locations as well for consultations and the such.
Right.
We also have information sessions with the local bodies like the Alzheimer and Dementia Association. So we partner with the different associations within the Cayman Islands as well, to also help them to get the word out, as well as obviously help Health City to get out the word about the specialists that we have and how we could potentially help if needed. So it's a varied approach.
There's also support groups, Andy, for MS patients in Cayman Islands. It's basically founded by people who have multiple sclerosis. You can find it on Facebook, MSF Cayman, and it's a very good organization. We do partner with them as well. So if there's any patient who needs financial assistance or anything like that, we do reach out to them.
Yeah, so folks, MSF Cayman is their social media handle, and you can certainly check them out. I noticed they haven't posted anything since 2024, but they do have a contact number as well there, and it seems like they have a website and some other ways of reaching out to them. So reach out to the MS Foundation, and I'm sure that they have a wonderful support group here on island for people who might be diagnosed with MS. So we have a question from one of our listeners. So K-Man 49er, good morning, sir. He says, how aggressive can MS be once diagnosed, or is it more gradual over time?
So again, it depends on the type of MS. But if MS is diagnosed early and the patient is started on disease-modifying therapies, generally the patients do well. There is an aggressive form of MS known as primary progressive, where the disease keeps progressing. But as I said, the most common one is relapsing remitting MS, and that form of MS responds very, very well to the disease-modifying therapies.
All right. Very, very good question. So Siobhan says that she has an appointment in August for a neurologist, and she is, a little bit concerned that she has to wait that long. So this is May, so that's about 3 months out. Tell us a little bit about maybe Shamari can just tune in on this bit, but about the wait period at Health City Cayman Islands. So if they were contacted today, how soon could they see one of the neurologists there?
Yeah, I mean, typically a few days. So I see the person said on Smith Road, so I don't think that's with Health City.
Right.
But if that's why we have one of the reasons, obviously, that we have a full team, that we're able to see people quicker or sooner than later. So definitely, if the individual wants to reach out, 640-4040 info@healthcity.ky, we definitely be able to get them in short order. To see one of our two consultants from a neurology perspective.
Yes. And there's no need really for people to have to suffer in silence or suffer alone, right? There is medical intervention, my apologies, that is available to them. So having a good support network when you get a diagnosis like this is obviously very, very important. If this is a disease that is a much younger person's disease, you could live 50, 60 years with this quite easily, right, doctors? So having that support around you would be incredibly critical.
Absolutely, yes.
Absolutely.
All right. And then storytelling, also a way to encourage people to share their diagnostic journeys, to inspire and inform other people, to let you know that there's hope. And I've actually reached out to, because we haven't heard from Anne Maria in a little while, but we have reached out to her just now to say, hey, in light of the World MS Day, would you like to come in the program and sort of recap your story of, how she was diagnosed and how she's managing and how she's doing with her treatments? Because that always gives you hope when you see other people who manage it very, very well, and they have access to the professionals that help them do that. You know that this is not a death sentence. This is something that you can live a really good quality of life with.
Yes.
All right, fantastic. Is there anything else that we needed to know about World MS Day? Now, Shamari, I know you've got some other specials that we're going to spend a little bit of time on, because it is of course, the 11th anniversary. It snuck up on us this year of Health City Cayman Islands being here, and so we're going to talk about that. But is there anything further that we could touch on with MS that's important, doctors?
So again, with all medical conditions, if you develop a new symptom, it's best to get it urgently evaluated. If wait times or appointments are too long, you can always go to urgent care or even the emergency department, where the patient can be evaluated. And with all medical conditions, early intervention would always be the best.
All right.
And once you're diagnosed, it's important to get into these support groups, because it's a disease that's not going to go away. You will need support, both mentally, psychologically, and physical support over the period of time, because we know a lot of these patients, they go into depression or mental issues because of the chronic illness, especially at a young age group if they're affected. So once the diagnosis is done, this ancillary support is equally important.
Okay, fantastic. Well, thank you both so much. Shamari, can we transition a little bit to the special for the anniversary promotion. 11 years. It is so hard to believe that it has been that long. I remember I was actually at the official, grand opening event at Health City in East End 11 years ago. I actually had my sister-in-law, she wasn't sister-in-law at the time, but my now sister-in-law, I had her fly in from Jamaica because she was a nurse. And I said to her, "Oh, there's exciting stuff happening in the medical profession here. You should come and check out this, world-class facility." And she came down and the two of us attended the official opening. And it was amazing to see a facility of the caliber, the size. I remember going through and doing the little tour back then. And I cannot believe that you're telling me that it has been 11 years already. Wow.
11 years and a lot of milestones and a lot of firsts in the Caribbean, a lot of lives saved. And we're just excited for the next journey of what Health City is becoming and what we're doing. And as you saw, 11th year crept up on us just because we had so much going on with Camana Bay and all of the different departments and all of the different milestones. But that being said, we're still, as always, offering our executive health anniversary promotion. So for just $500 US, so we already make it, cost effective that it typically is $799. So what we're doing, $699, what we're doing is we're giving $199 off. So 500 USD. You can actually book your executive health check. And this one, we make this promotion available that if you have a wellness benefit, which typically would at the least be $500, you can use that as well to come in and get your executive health check. And you have to do your appointments. However, you have to actually book it in May. So that's 3 days that you're going to have left, around 3 to 4 days left to go ahead and book 640-4040. Or you can go through the website, or you can go through our Connect app, and our website is healthcity.ky. Or you can even, if you just want to email us, info@healthcity.ky. Let us know you want to take up the promotion for the executive health check anniversary, and we'll go ahead and get that set. Appointments, you'll need to, we're scheduling them from now until June 12th. But definitely you need to book before the end of May. So exciting times. And within the next, we have a few topics, but the anniversary as well as our impact, we're definitely going to have a program where Dr. Benoit and I will come on. We have a video as well that you will be able to play as well as speak to within the next 3 weeks, just to show all that we've done within our first 10 years going into 11 years now as Health City Cayman Islands. And what's also interesting is we actually have a journalist, not we, but there is a journalist on island that's actually coming to interview and do a documentary from another Caribbean island to speak to the impact Health City has, look at what Health City has done, just because we've also helped to make a major impact in that Caribbean country as well. So we have a lot that's going on, as well as a lot of the other countries are also paying attention and understanding the value that we not only, of course, brought to the Cayman Islands, but to the surrounding region as well. My apologies, I don't have my camera on because I won't call the internet provider that I have, but it's, I don't know what's going on. I was upstairs, it wasn't working. Came downstairs, still isn't working. So figure that out. I'll figure that out one day. But I turn off the camera to try and get a little bit more bandwidth.
Yes. So we have someone here who says, I'm still trying to win a health check from Health City Cayman Islands. Are we going to be giving anything away, Shamari, for the anniversary?
Next program. Can you hear me?
Yeah.
Next program. Tell the person to tune in.
All right. So you get a little sneak peek there to make sure you tune in on next Tuesday. Nice. We love a giveaway here on the program. So make sure you're listening and you got your fingers close to the speed dial.
Can you hear me now, Sandy?
Yes, I can hear you.
Okay,
Uh-oh.
perfect. So I was
Yes.
before the internet goes out again. The next
Oh,
program, definitely tell the person to tune in. We're going to have some giveaways.
okay. Yes, he's struggling with that internet today, but yes, next Tuesday.
I don't know if you got that, Sandy.
We more or less we got it. So next Tuesday, we'll do some giveaways for the anniversary. So 11 years, Health City Cayman Islands has been here. Miss Siobhan says, I think I'll do just that in terms of reaching out to Health City because 3 months is a no for me. And I've been dealing with this issue since February. So yes, no need to wait. Definitely reach out to us. So Shamari and Dr. Ramnesh and Dr. Susant, thank you so much for reaching out. Make sure those of you who are listening in Radio Land as well as on social media, do not miss next Tuesday because there will be some anniversary giveaways in celebration of the 11th anniversary of Health City Cayman Islands being here. And of course, they've just opened their new location there at Camana Bay, which is a wonderful asset to the community for those who live either in the west, or you work in that area during the day. If you have to pop in and out for medication, they've got a pharmacy there. They've got the NICU unit. So if you got to visit somebody and the baby, you can do it on your lunch break now. They've got an amazing maternity ward and so many services. I went there about 2 weeks ago, I think, maybe last week or so, to pick up a prescription, and it was bustling. It was actually very, very busy at that location. It was so nice to see. And just yesterday, my daughter, we were in the area, and she says, "Can we go to Camana Bay?" And I said, "Well, can we go to Health City?" And I said, "What? Why? Are you not feeling well? Like, what's the problem?" And she's like, "No, I want to pick up a snack," because they have these healthy snacks. They've got some healthy bars and some bananas and stuff. And she's like really into the health bars that they have there. So she wanted to pop in there and get one. I said, they're for patients. Like when you go there for an appointment. She thinks you guys are a restaurant. Can you imagine?
That's okay, Sandy. That the fact that she's willing to come to the hospital, that's a good thing. That's a good thing.
Yes, absolutely. So and they are available. Things pop up. They've got pediatricians there. I do want to remind people as a parent, sometimes something comes up and you've got to see a pediatrician quite quickly. Questions as they're growing, you got growing pains and all sorts of stuff. The pediatricians are obviously there as well that you can see. So lots of experts at both locations. And when you call them, you can tell them often what your preference is if you'd like to have an appointment at one or the other. And you can do blood work, labs, everything at both locations as well. So Shamari, anything else pressing that we need to cover today?
No, that was it. Internet's back.
Yeah.
So just want to say thank you for having us on the program again. Good morning, Cayman Islands, and look forward to those persons that want to get the executive health check going ahead and booking $500 USD, and you can get your health check. Or if you have a wellness benefit, you can use it to be able to come and get that health check. And tune in for next week, because definitely we'll have some giveaways for our 11th anniversary. You're going to have to listen in good to answer some questions, but we're definitely going to be having some giveaways next week for those individuals that want to win a executive health check.
Fantastic. And we appreciate that, Shamari. So we'll definitely see you next week. And I just want to remind people that on social media, there is quite a bit of information on Health City Cayman Islands, Facebook and social media pages. They're also on Instagram. For example, they're having antenatal classes, which have started already, started May the 12th. And they go through to July, and then they will sort of circulate through. So if you are interested in those, make sure that you reach out. So a whole slew of antenatal classes available at the Health City location to help you through every stage of pregnancy, from nutrition tips to birth prep and postpartum newborn care. Their sessions are really designed to keep a new mom and all members of the family informed and empowered. So check them out. You can email maternity@healthcity.ky. They also have a whole team around the maternity ward, the NICU, and I actually have to get in there. Dr. Mohini is an obstetrician and gynecologist, very, very compassionate, and you can make an appointment with her because she has experience in managing women's health for 8 years, highly qualified as well as the rest of her team. So that's one appointment that I've got to get in there for, ladies. You know, you got to do your annual pap smear. And don't forget that the headache clinic is coming out with Dr. Rose Gianmarco. That's going to be June the 5th. So that's literally right around the corner because this month flew by so quickly. Let me just see. When is June the 5th? It's like, isn't that next week? Listen, folks, it's here pretty fast. So plan ahead. You can contact them. It's a little bit more than a week away. They're going to be having the headache clinic. And we've had Dr. Rose on the program before. She's the headache specialist that comes and visits, and she's going to be available on June the 5th, offering expert care to help you find relief. So once again, if you're suffering from headaches, don't suffer in pain. You can call 640-4040. Or there's a link there that you can also click on from their social media handle to get an appointment with her. And she is amazing. And I know a lot of people have received good help from her as well. And don't forget, there's lots of other things being celebrated. Dementia Action Week is this week, and they're highlighting the importance of early support and understanding for those living with dementia. This is a disease. It's not a single disease, but it's a group of symptoms caused by damage to the brain, affecting memory, thinking, behavior, and the ability to carry out everyday tasks. So once again, the same neurologists and their team that you saw here this morning, they can provide expert assessment, diagnosis, and personalized care for patients facing an Alzheimer's or any other form of dementia diagnosis. So reach out to them. If your loved one is suffering from memory loss or any sort of cognitive change that you need to look into, and they've got, again, the team of neuroscience, neurologists there to help with that also. So big shout out to that amazing team. Yes, I think that about covers it. So fantastic. Thank you, Health City Cayman Islands, for all of the amazing work that is done here with the physicians, and congrats also on the filming that was mentioned. That sounds like a very exciting opportunity. All right. Mr. Richard says, I got a late start this morning, but I'm walking with CMR. It's a beautiful day in Round Rock, Texas. Richard, does it ever snow there? I was kind of thinking about this. Does it snow there at all? I'm trying different little ways to preview my, hold on. I think this one. Yeah. Does it ever snow there in Round Rock, Texas? Because it sounds like you're walking no matter what every morning, which is fantastic. I mean, I love that. That's quite good. Faith and Hope, good morning to you. Vanessa says, good morning, Sandy. No one is having kids. Cayman is too expensive. Oh my goodness, not that. Have one or two, and I think you'll be okay. You can still afford one or two. You can't afford much more than that, though. I'm going to be honest. I agree that Cayman is expensive. Where's Debbie from Thailand? Debbie, you with us this morning? Shaka Zulu says, now you know how to lure her to the hospital. I know. She doesn't mind going to the Cayman Bay location because she knows exactly where the snacks are located. And she loves, I don't know what bar. It's some little bar, and she just loves it. So yes, she certainly does not mind that one at all. So Richard said, yes, it does snow here. We had a horrifying snowstorm that lasted 7 days, and we were snowed in. Ooh, wow. Yes, that's why the summer months, we're into spring and summer now. So I guess enjoy as much of the outdoor space as you possibly can. Ooh, that does not sound like fun. Good morning, Missy. I love that cute little, what is that exactly? Cute little character that you put up there. So everybody's good. Happy Tuesday. What's the name of the doctor for headache, please? Kind of missed that part of the info. Oh, yes. Okay, so her name, hold on. Let me get it for you again. Her name is Dr. Wait. I'm going to put it up here on the screen. Dr. Rose Giamarco. And she comes in, I believe, from Canada. I'm going to post this up on our social media page. Let me post this up right now. So those of you who follow CMR, and I know a lot of you do, you'll have access to this information. I hope Shamari doesn't mind me just grabbing his post and resharing it. All right. So Dr. Rose will be here June the 5th. They still do bring in some specialists, although they have a lot right here on hand as well. All right. So Dr. Rose, and I'll send that out to all of our CMR followers. Yes. Let me see here. Okay, so good stuff. There you go. And follow their page. It's good if you can follow their social handles and stuff as well. All right, so beautiful. Let me just see what else we got here. Any other questions? Aisle 2025 says people can't afford one or two. You have to think beyond the first 18 years. Kids will have to live with their parents forever due to the cost of housing. Well, honey child, mine will not be living with me forever. Although it doesn't seem like she's going to mind, because she's already like, do I have to leave? Do I have to get married? Do I have to have kids? At that age, they're already thinking like the things that people are expecting of them. And I say to her, quite frankly, no, you don't have to do. I said, you don't have to have kids, because she seems to think that every woman has to have kids. I'm like, you don't, if you don't want to. I mean, don't do something you don't want to do. I think only people who actually love children should be having them. And some of y'all don't really care for kids, or whatever other reason you have, that's fine. So I say to her, you don't have to. That's up to you. Just like you don't have to get married. The only thing that you have to do in life is get yourself an education. That's my only have to requirement that I have for her. And that can take many, many different forms. It certainly does not have to be a traditional 4-year university degree, but you can't sit down and do nothing, honey child. You have definitely got to, do something with your life. Not doing anything at all is certainly not an option. I think she gets that part now, because we have these little conversations all the time. Can I tell y'all about a conversation we had the other day? This one is so funny. I started to record it because she was saying to me, we were driving. We have these really great conversations after school pickup, and we were driving, and she said, Mom, this is Friday, I think. Yes, because I picked her up and I said, Mr. Andre is going to come by, the honorable premier, he's going to come by. And she's like, well, what does the premier do? So she has a lot of questions about these sorts of things. And I say, she actually, actually does a lot of things, but essentially he runs the country. He's in charge of the country, so to speak, right? Trying to break it down for an 8-year-old to understand. She said, oh, okay. He runs the country. Wow, that's like a big job. I said, yeah, it sure is. And then she said to me, I'm going to find the clip and make you guys listen to it one day. She says to me, did you, because we just had an election. She said, did you vote for him? And I said, no, because he wasn't running in my area. So she's like, oh, so it's different for each area. And I said, yes, there's like different, And I said, but we're supportive of this group and we hope that they can do a really good job. Then she asked me the most interesting question, which I had to really reflect on. She said, so, because I said, yeah, I like him and I think he's going to do a good job. So then she's like, so you trust him then? And I was like, what? She says, yes, because you don't trust a lot of people. I thought, oh my God, let me see if this is, I'm going to see if I can, hold on. I'm going to see if this is it. She says, you don't trust a lot of people. And I thought to myself, OMG, how does my daughter know that I don't trust a lot of people? Let me see if this is the Gigi discussion that I can play for you guys. She's like, yes, Mom, you don't really trust a lot of people. I said, really? She said, no, you don't trust a lot of people. So if you trust him, in her brain, then she's like, that's a really big deal. All right, give me one quick second. I'm going to see if I can find it. Hold on.
Recover Personal Injury Attorneys, helping injured people get what they deserve. Did you know that insurance companies have lawyers that represent their interests? Before signing and accepting any settlement, know your rights. Call us today for a free consultation at 924-9999. That's 924-9999. Recover. Your personal injury attorneys are on standby to assist.
Ocean Ridge Heights offers an amazing opportunity to own a piece of land in idyllic Cayman Brac, right on the bluff, starting from $80,000. Located in a quiet residential area with high elevation, these lots are ideal for a future home or investment property and are sure to go fast. Cayman Brac offers a laid-back lifestyle, amazing pristine diving, limestone caves, diverse flora, along with amazing wildlife. Inquire about the owner financing options so that you can secure your piece of paradise today. With only a few lots remaining, these are sure to go before you know it. Contact Crichton Properties today on 345-949-5250 or info@crichtonproperties.com.
I managed to find it. You guys got to hear this discussion. So she likes to ask a lot of questions. She's very, very inquisitive. But this was our conversation recently in the car. So listen to some of this. This was so interesting.
To what
She's
I'm
so funny.
doing.
Uh-huh.
Because if he tells me to do something, right?
So you think you should be able to trust someone that you're voting for?
Mhm.
Yeah, that's true. Yeah. I agree with that. So then so this was after she said to me, oh, you must trust him then, if you would vote for him. And then she's like, I try to ask her questions to kind of engage her brain a little bit. So I said, oh, do you think that you should trust someone that you're voting for? And she's like, yes.
Do you trust the person that runs the island?
You see, she's like, do you trust the person that runs the island? Mr. Andre?
Mhm.
Yes, I trust Mr. Andre. Mm-hmm.
I hope so, Mom.
Yep.
Because I'm not sure you trust that much people.
Oh, that is very true. How did you know that? You're right. I don't trust very many people. She's so funny. You're kind of smart. You seem to know what's going on. You trust many people.
I know everything.
You know everything? Oh my gosh. Mm-hmm. But yes, I do trust him until he gives me a reason not to. Mm-hmm. So far, so good.
I trust some people I know.
Yeah.
Some people that are not really kind, I don't trust.
You don't trust people that are not kind?
Yeah.
That's a good idea, I think.
Because if I'm friends with someone that's not kind and I trust them, well, it kind of wouldn't make sense. Because why would you trust a person that's not nice to you?
That's true.
They can do anything wrong to you.
Yep, that's right. That's very good advice. Because you have to look at what people do and not what they say. Because sometimes people say what they think you want to hear, or they'll say what sounds good, but they do the opposite. So that's why they say actions speak louder than words. That's a saying. Actions speak louder than words. And so you have to look carefully at what people do. Not always what they say, especially if the two don't match. Like if they say one thing and do the opposite, the thing that you watch is what they do, not what they say.
Yeah. Wait, Mom, be quiet. Zeus chewing his bone.
Zeus is chewing his bone back there.
Yeah.
Oh my gosh. Yeah, sounds like he's enjoying it.
Maybe most dogs do like that bone.
Yeah, sounds like it. Zeus is having a moment with a little bone.
Yep. To what I'm doing.
Uh-huh.
Because if he tells me to do something, right,
So you think you should be able to trust someone that you're voting for?
Mm-hmm.
Yeah, that's true. So yes, I mean that's her. She's like, yeah, I think you should be able to trust someone that you're voting for. And she's like, you trust Mr. Andre? And I said, when I said yes, she seems to have been taken aback because she's like, you don't trust very many people. And I think that is so interesting because it's true, I'm sure of that. But it's so interesting that she has picked up on that. She's only 8 years old. And somehow she knows that I don't trust a whole lot of people, especially with her, right? But probably generally in life, I'm a little bit more, on the skeptical side. Miss Faith and Hope says that's a lawyer part of her, of you in her. Yeah, she likes to think about things a little bit and then she'll say, right, Mom? Like she's looking for confirmation. So, yes, I said, look at what people do. Because as we say, actions speak louder than words. Sometimes you use these little phrases with kids and they don't know what they mean yet. And she's like, what does that mean? And I said, you got to look at what people do. But look at how she connected the dots. Like, if people are not nice to you, then you can't trust them. And that is so true, right? If somebody mistreats you, this goes for little kids as well as adults. You certainly can't trust them. So Carrie says, nope, trust no one. Oh my goodness. We got to trust some people. And like I said, I give people, some people a degree of trust until they give me a reason not to trust them. Because it's kind of a tough world if you go around automatically not trusting everybody. You gotta give some people the benefit of the doubt. But there's some things I take no chances with. When it comes to my daughter, I ain't taking no chances. I will not be trusting you, okay? Don't feel any way about it. Carrie, morning from the Bluff, the beautiful, beautiful Bluff, where it's extra hot in Cayman Brac. I think Cayman Brac is at least 10 degrees hotter than Grand Cayman for real. So we have an amazing interview that is coming up on, let me think now. Well, I'll let you know when we're going to be airing Cayman Voices, speaking of Cayman Brac. But today, what I want to do is I'm going to go ahead and drop the interview. Should I do that today or tomorrow? Tomorrow's Wednesday. No, we can't do it tomorrow. We have Mr. Franz Manderson on tomorrow. Ooh, honey child, tomorrow's a big day. So y'all make sure you tune in tomorrow. Mr. Franz Manderson is going to be joining us talking about this new rollover policy. So I will drop the interview today then. So we're going to do not the interview, but the RCIPS, their annual meeting. So let's play that today. Let me update you on the court situation, because of course I love to give you guys updates on where we are. So I went to court briefly yesterday morning. This is for the criminal trial now. This is the only one I have outstanding at this time with John Felder. So this is where John Felder claims, and the police and the DPP rushed to his rescue, that my attempts to settle a civil case on the instructions of the judge, and I sent him an email saying, this is what I can give up, if you do this. He's saying that that's blackmail. In my head, it was how you settle civil cases and how I've done all the rest of them. But anywho, that's not his position. And of course, the DPP always loves to go at me. So there you have it. They're going to try their hands at yet another case. So we were doing jury selection. They had, I think, close to 50 people yesterday, but unfortunately, between my attorney and the defense, they only found 4 people that they could, they only found 4 people that they could put in the jury pool. So it looks like we're not going to be having that trial anytime soon. I'm not too sure. We'll have to wait and see what happens. I don't know. And then the other thing is he's not on island. So he is not here. And low key, it looks like he doesn't want to be here because he knows a lot of people are looking for him for all the money that he owes them, including me. Sir, I would like my $50,000 that you owe me. Yeah, how about my money? So he's not here and he's refusing to come. He's making up excuses on why he can't be here. Anybody friends with him on social media, I actually want you to reach out to me. I need something from you and I'll tell you more about it. But so he's not on island. And yeah, we kind of need him to come and to be here. Lizette says Gigi knows everything. That's what she thinks. She always says, I know everything, Mom. I'm like, girl, you only getting started in life. Trust me when I tell you, you don't know jack. So sit back, listen to the RCIPS interview. Let me see if it is ready. Hold on, honey chill. Where did I do? Oh, it's still downloading. Oh gosh, it's a big file. It'll take a few minutes. All right, so let's keep talking while that happens. Okay, the other court update is on Thursday. So I go back tomorrow. I don't know. I don't think they're going to find any more jurors. And we need 7 at least. So then we go back on Thursday because the Court of Appeal has issued their judgment. It's going to be read. This is now the Matthew Leslie Court of Appeal. So they have issued it and it will be read in court on Thursday morning. So I will be there Thursday for that. And of course, CMR will cover it in terms of news. But if you'd like to see this, I mean, it is a pretty big deal to get to the Court of Appeal level. Courts are open, so you can come and you can sit there and you can listen to the reading of the judgment. So come on out, honey child. I don't know what courtroom yet. I'll try to find out what courtroom we'll be in, but that's on Thursday morning. So big court week this week. For me, the judgment is ready. Their written judgment is ready. And then basically they just send it through and they've instructed her to read it essentially. So somebody says, "Ah, so sweet, yours and your little baby girl, so smart and loving conversation. Give me the goosebumps, smiling ear to ear. Thanks for sharing. And I know for sure that made the Honorable Premier's day as well." I'm not so sure he heard it. Today is Tuesday, so normally they're pretty busy on Tuesdays getting ready for cabinet and that sort of thing. But I will send it through to him. I think he'll enjoy it. Another person says, "She's so sweet. Tell her to stay out of politics, though." Laughing out loud. My little angel, Miss Gigi. Poor child needs another sibling. Oh my God, she's been writing me about this, and I'm telling her shop is closed. It's too late. Mommy's too old for that sort of thing. So yes. She's like, "I want a little brother or sister or a rabbit." I'm like, no to all 3. She's been going on and on and on about rabbits recently. And it's hard for kids to understand that it's not easy to have pets because, you got to have a plan when you travel. Where's this rabbit going to stay? What's going to happen to the rabbit? And speaking of animals, poor little Zeus, where is he? He's here. I need to give him his medication. He had a little accident Sunday night, which was kind of my fault as well. Oh my gosh, I feel so bad. He injured his tail. So let me tell you guys what happened. Oh, I feel so horrible. So he went to the beach earlier in the day. And I think he was really, really tired. You run him around a bit more out in this hot sun, they get tired. And so normally when I recline in the sofa, he'll come and sit by my foot, which he had been doing earlier in the day because I was reclining. And then this last time I was reclining, he wasn't there. He was actually underneath the recliner and I did not know. Oh my God. So I ended up closing the recliner and not realizing that Zeus was underneath it until I hear this yelping. And I was like, oh my God. And then we're in full panic mode. I'm like trying to hurry up and jump off of the recliner because of course that's added weight, trying to open it back up. And I'm like, which way is it to open again? Because when you're like panic, you can't remember which button does what anymore. And he was caught underneath the recliner. So poor little Zeusy. When we finally opened it up, he still couldn't get out because his tail was caught in the mechanism that closes and opens that part of the recliner. So I had to literally get on the floor and pull him out. Oh, somebody said Mr. Andre was at the exclusion Cayman inclusion, sorry, Cayman breakfast this morning. Oh, nice. So yes, I had to pull him out. And then I was so worried. So yesterday we were frantically looking for a vet that would take him. And, most of them like, oh, no spots for emergencies. I'm like, what? They were booked up until the afternoon. So anyway, big shout out to the very, very kind people here in Savannah. They were able to see him earlier than anybody else. So that is although that's not his normal place, they still were happy. That's the veterinary clinic and specialty pet boarding right here in the Savannah area. And so they took him in because I was afraid that his poor little tail might have been broken or something. And so I'm going to show you guys, if you're really, really sensitive, probably don't look at this picture, but let me show you what happened to Zeus's little tail. Oh, so it got injured. So they had to actually shave it down, took some x-rays. Thankfully, it's not broken, but he wasn't all night Sunday night. I noticed that he wasn't lifting his tail. He looked like he was in a bit of discomfort. So of course I didn't want him to be suffering in any way. So we took him to the vet. They gave him some medication. And so now he's got to take medication for the next week, pain meds, and to make sure it doesn't get infected in any way. And he's got the dreaded cone. Dogs don't like the cone. He's got the dreaded cone on his neck so that he doesn't lick it because that might cause it to get infected. So this is my little pumpkin. Oh my gosh. Poor little thing. So yeah, so I think he's right behind me. He still follows me up and down all day long. So I'm going to feed him now because I have to kind of maneuver around the cone to feed him, give him some nice fresh water and make sure he takes his medication. Karen says Dr. Olivia and Dr. Shannon are great. We love the Savannah vets. I don't know which one I saw, to be honest, because I wasn't even like paying attention. I was just like, is he okay? She showed me the x-ray. She says, thankfully, nothing is broken. Now we just have to wait and see what happens because sometimes they can have nerve damage when they have a tail injury. Because did you know that if a dog breaks its tail, you can't repair it? I didn't even know that. So there's no cast or anything that you can put on it to repair it. That's when they actually have to cut it. They have to surgically remove the part that's broken. I didn't even know that. Oh my God. Thank God that's not the case. But, oh my goodness, poor Zeus. So I am just traumatized. So now I have to consciously think, okay, if he's not on top of the recliner, let me look around and call him to make sure he's not under the recliner. And even after that happened, he was so scared that he was trying to go back under the recliner. I was like, no, don't go there. So Cayman Brack says, my cat Ruby did the same thing, had to cut part of her tail off. I hope Zeus feels better. Well, the good news is this morning when I was walking him, I already noticed that he was lifting it. So yesterday he wasn't really lifting his tail. He is lifting it today. He was wagging it even yesterday. He's such a sweetheart. So she said another dog came in, and when he saw the other dog, he was wagging his little tail, although it was injured. Oh, poor little thing. So he was wagging his tail today as well, and he actually is lifting it, and it's curling. It's already starting to curl back up. So I think he's going to be fine. We just have to follow the doctor's instructions, give him his medication and everything. And I think he'll be fine. So big shout out to, I think that might've been Dr. Shannon, but I'm not sure. Big shout out to the vets here in Savannah. Really, really appreciate it. Another one of the vets, not my usual one, but another one of them were like, oh no, we only take our own clients, even for emergencies. I was like, really? That's interesting. And then they're like, then he's like, oh, well, let me speak to our physicians. And 2 seconds later, well, no. We just had an emergency that walked in. I was like, you guys are so funny. Anyway, let me see. We're just completing the download, and we're going to be watching the RCIPS. They had a press conference 2 weeks ago now. 2 weeks tomorrow will be 2 weeks, where they went over the statistics. And I want you guys to listen to this because there's quite a bit that was said in it. It's about an hour and 22 minutes. So obviously radio folks, you're going to miss some of it unless you log on to social media, but it is definitely worth listening to. And I think you will learn a lot. So thank you so much. Yes, that's Dr. Benjamin. Is Dr. Benjamin still around? I haven't seen him in a minute. So I'm not so sure if he's still around. But anyway, here we go. Let me just get this. Looks like it's completing the download process, appending all download parts into one file. So give me 1 second and we will get this uploaded here shortly. All right. So thanks again. Vets, just like good doctors, can really make a huge difference in your life. So folks, don't forget this week. Did you guys see my AI? I called it Sandy Hill version 2.0. It's probably not exactly a full version improvement, but in case you guys missed it yesterday, this is, and listen, I'm embracing AI now. I know I told you guys at first I was a little bit afraid of it. And so I was apprehensive about doing anything related to AI. Now I've said, you know what? Dive in, full head, full steam. And we are going to just embrace it, learn as much as we can, and use it to improve the CMR platform. So look at what I was able to do with the weather yesterday. We have this Saharan dust plume that is headed our way. So please know that will increase some cloudiness. If you suffer from allergies and stuff, this is probably going to be a tough week for you. So maybe try to stay indoors more. Because the air quality outdoors might be compromised. So this isn't bad. I actually uploaded a photo of me and asked it to generate like a thing from me. And it kind of, you can see certain aspects of like my cheeks and stuff where it does kind of look like me. But yeah, she doesn't look bad at all. She looks very interesting. But here's the Sandy AI 2.0.
Now, here's your official public weather forecast from the Cayman Islands National Weather Service, valid for this afternoon, May 26th, through tomorrow, May 27th.
Mm-hmm.
A weak ridge of high pressure is still in place across the Northwest Caribbean. That's helping to keep our winds and seas light to moderate for now. But looking further east, a tropical wave currently moving through the eastern Caribbean is expected to reach the Cayman area by Tuesday evening, and that could bring an uptick in isolated showers. Radar this afternoon is already picking up scattered showers in and around the islands, moving westward. As for today's conditions, partly cloudy skies will prevail, with just a 20% chance of afternoon showers. Temperatures will climb into the low 90s, but it'll feel much hotter, with a heat index around 104 degrees Fahrenheit. Winds will be from the east to southeast at 10 to 15 knots, and seas are expected to remain slight to moderate, with wave heights between 2 and 4 feet. Tonight's forecast includes partly cloudy skies with a slight 20% chance of early morning showers. Overnight lows will fall to the low 80s. Winds will ease a bit, blowing from the east to southeast at 5 to 10 knots. Seas will remain at 2 to 4 feet. For tomorrow, expect very similar conditions to be in the forecast. Partly cloudy with a 20% chance of afternoon showers. Highs again in the low 90s, with that heat index staying near 104. Winds remain steady from the east to southeast at 10 to 15 knots, and seas will hold at slight to moderate levels. Now, a quick look at the tides. Today, high at 8:10 a.m., low at 2:56 p.m., and another high tide at 9:51 tonight. Tomorrow, low at 3:55 a.m., high at 9:01 a.m., low at 3:42 p.m., and high tide again at 10:41 p.m. Sunset this evening is at 6:56 p.m., and sunrise tomorrow is at 5:48 a.m. Conditions are expected to remain mostly the same through Wednesday evening. However, a plume of Saharan dust is forecast to move into our area by Wednesday morning, which could bring hazier skies and lower air quality to the region. That's your latest weather update right here on CMR Daily Buzz. Stay cool, stay hydrated, and we'll keep you informed.
All right. So not too shabby for a first attempt. I would say, and I'm going to be honest with you here, folks. Carrie said put some glasses on it and you're good to go. It was based off of this picture. That's why she kind of looks like she has a lot of teeth, because I was smiling here. So they took the teeth and the mouth and they kind of, but yes, I mean, this is before I was wearing glasses again, honey child. So I think I need to do like a photo with me wearing glasses, and then, I guess she'll get it. But yeah, still not too bad. I mean, and Barbara says the sound is out of sync. Actually, the sound I thought was pretty much aligned almost perfectly. I was impressed with the alignment of the lips and the sound. Now, let me show you what else we did, and then we're going to upload the video here. So imagine me doing the evening news with multiple characters, multiple AI generated characters like this. And guess what? This is not no $1 million studio, but it sure looks darn good to me. I'm just saying. So I'm gonna try to create an entire news segment using different AI people. Yes, isn't that amazing? I think that is so cool. We can have a guy doing sports. Oh my gosh, I'm so into it now. I'm totally into it. So here's a baby picture of me. That's an old passport picture. Child, I did not look happy. That was probably me going to, I don't know how old, that would have been me probably going to Canada. I was like, you're taking me where? Away from my Cayman mangoes? Are you kidding? Cayman says your AI sounds and looks better than that new TV. You're so silly. But let me show you guys this, because this is really funny, right? So basically, I wanted it to do like a baby version of me. And this is what the baby version of this picture, this is what the baby version looks like. Isn't that the cutest little thing? They got the ears pretty good. You see the little, like I have a little indentation there under the nose. So they put that in there a bit more. They gave me some good full lips. I mean, I don't think it looks too bad. I don't really have any baby pictures of myself, believe it or not. So I don't even know. But yeah, I mean, that's probably what I looked like. I don't know how much hair I had as a baby, but there you go. Isn't that the cutest little thing? Somebody said, oh my God, I can see Gigi in that picture of you. It is kind of funny though, but they got the eyes, the big eyes. They got the eyebrows. She is so cute. Oh my goodness. The cutest thing. Oh, I love it. I love it. I love what AI is doing. It's amazing. So yeah, we'll continue to improve. Yes, the teeth, Miss Romelia, it's because of this picture. I was all teeth. I was getting my makeup done for a family photo shoot when Gigi was about 2 years old, I think. She was walking, so that's how I remember, more or less. She's probably around 2. All right, so let's queue up our press conference from the RCIPS. We decided to record it this time so that the quality was as good as possible. Sit back, folks, and you're going to hear some really shocking things and some interesting recommendations from the police commissioner. All right, here we go. So I got to tell my video guy that he could have clipped out this little bit in the beginning while we were all getting ready, while people were chit-chatting. All right. So, and thanks to our SafeJet for having this event as well. Okay. Yeah. Is this the right video? Because I feel like this is not the right video. Hold on. I bet you I've completely. Hold on, folks. Somehow I bet you I have, because I do not think my videographer would have left all of that in there. Give me 1 second. I am willing to bet that's probably my mistake. Let me look at exported videos. Oh, yes, of course I downloaded the wrong one. Duh. I'm looking at that going, there is no way that he would have not clipped all of that chatter beforehand. Ugh, Lord have mercy. Poor me. What a mess. Hold on, honey child. As I'm looking at it, I'm like, that's probably the original video before he edited it. Okay. Yep, it sure was. Give me 1 second. Wrong video. Gosh. All right. This one is probably going to be quicker to download because he has to compress it a little bit. My original file is quite large. So let me just confirm. Yeah. All right. Give me a quick second. It's going to download a lot quicker. It says 1 minute and 47 seconds. So 2 minutes and 25 seconds it went up. This is a 5 gig file. So this will download quickly. All right. Give me a few minutes. Sorry about that, folks. Ramelia says, I'm going to put a trail of turned mangoes leading into Windsor Park and Washington Boulevard. That's how she is going to get me to come and visit her. Well, it would work. It would work. I was here last night thanking Mr. Crawford for the beautiful bag of turned mangoes that he left me. And child, I was sitting down with my seasoned salt and pepper last night, enjoying a few of these beautiful, and I do mean beautiful, turned mangoes. Oh my gosh, look at me. I think I had about a 4 last night. Look at me, enjoying them. Sprinkle of seasoned salt, a little bit of pepper. Nothing better than that, honey child. I love it. Jazara says, that is so cool. I know I'm going to do the baby talking head soon too. I think it's just the most adorable thing. But AI is being used for a lot of serious things, and I'm just here to learn as much as I possibly can. Let me tell you. Sandy, do you have on that white dress? I know you're pretty much around at that time. You were at Miss Gleeta's school, aka Breadfruit School. Really? You remember me? Oh my God, I can see Gigi in that picture, says another person. That's so funny. I'm gonna send it to my husband and see if he sees Gigi in that. Because everybody always said that she looks so much like him, but that's because I think his genes are really strong, but I think also, you look different as you get older. But yeah, there's a few baby pictures when I look at her, I'm like, Kieran Brack says AI is amazing. I am deep in it now. Yes, it is. And there's just so much that you can do. Ms. Lucille says, you love it, but that salt won't love you, Sandy. I know. And I try to, because I'm not really a salt person otherwise. So I don't cook with salt really and all this other stuff. It's the one time of year that I do increase my salt intake, but I also try to drink more water, hopefully to compensate for it, but I can't help it. Me and turned mangoes is like, that's my addiction. I just love it. Nothing, Jasara, I forgot actually to ask that question. Nothing new, she says, on the topic of the RCIPS. Was there any update on those arrested for the child from the BRAC? No, but I will send them an email asking for an update in relation to this because no, we haven't heard anything further. Unfortunately, that case really gets under my skin. All right, I think the file is now ready. My apologies, folks, for uploading the wrong file. Let me just grab this one, and then we're going to be on our way here in terms of the video footage. Okay, here we go, good folks.
Okay, so hello everyone, welcome today for the launch of the 2024 RCIPS Traffic and Crime Statistics Report. I'm Chanel Amon, I'm the Media Communications Manager here at the Office of the Commissioner of Police. I want to wish a special welcome to our media panel, and I'll do a quick introduction of who we've got. We've got Takia from CIG TV, Wendy from CNS, Ralph from Caymanian Times, Sandra from CMR, April from Radio Cayman, and Norma from Cayman Compass, and we've got Sean from Compass TV who is filming today's session. So on Tuesday we sent out a copy of the report under embargo to the media partners so you have time to review. I'm sure we've got lots of questions, and for that we've got our panel here to respond to you today. So on our panel we have the Commissioner of Police, Kurt Walton, We have Detective Superintendent Peter Lansdowne, who heads up our Criminal Investigations Department, or CID. We have Superintendent Roger Williams, who in 2024 oversaw the operations of police, including the traffic and road policing unit. And we also have Inspector Diane Dyer Alexander, who was the acting superintendent while Superintendent Lansdowne was on deployment to St Helena over the last few months. So shortly the Commissioner will provide his opening remarks on the report, and then once complete we'll open the floor for journalists to ask you questions. I just ask that when you pose a question, please state who you're directing it to so we can get the right person answering. And I'd like to ensure, just in the interest of time, that we try and maintain a bit of a balance between the questions. So I'll keep an eye on that, but I want to make sure everyone gets a fair chance. So we've allowed around 1 hour for today's press conference. After that, we give around 30 minutes to enable journalists to have more direct questioning with any of our media, any of our panel members, in sort of a more informal kind of setting. And we've also got other specialists in the room in case you want to speak to them too. So we've got members from our financial crimes unit, and we've also got members from protective services as well. So, without further ado, I'll hand over to Commissioner of Police, Kurt Walton, for his opening remarks.
Thank you, sir. Today, it's really important for us that we're here, that you're all here. So I'm just pleased that you've all invited. We took the opportunity just to extend. We know we should have started at 10:30. However, we understood a few of you, for various reasons, weren't able to make it at 10:30. We accept that. But just to give you the opportunity that everyone is here at the start, we extended that. So again, thank you. So the first thing, good morning. Just again, this is from the members of media attending our press conference at the 2024 Annual Crime and Traffic Statistics Report. Again, thank you for attending. I see this as an opportunity for you, the media, to engage with us and to critically assess the information provided and then report it to the public. I hope by the end of our discussion today, you will have recognized this. As you will have seen, we have refreshed the look of our report from previous years, and this is to give it a more contemporary and digestible feel, and is similar to other reports that we're now seeing internationally coming from other police forces. It moves away from a heavy narrative, as was previously done, although we have provided context which we believe will explain the figures. Now on to the report. You will see that in 2024, we responded to 34,934 incidents, of which 4,218 resulted in crimes. What this means is that although incidents decreased by 8% compared to 2023, overall crime increased by 7%. Within the executive summary, the increase in crime, while up in 5 of the 7 categories, 3 of those 5 categories mainly contribute to this increase. These are as follows: sexual crimes, which saw an increase of 21%, other crimes, which saw an increase of 23%, and drugs crimes, which saw an increase of 26%. Whereas the other 2 categories, acquisitive crime is up 4%, and public order crimes is up 6%. We will explain in more detail later in the press conference what this means as far as crime types. The other 6 and 7 crime categories of violence and firearms saw a decrease, with overall violence at 3% less than 2023, as well as firearms dropped by 21%. Now on to detections. Within the report, I'm sure you will be pleased to see, for the very first time, we have provided you our detection figures. As I promised during our press conference last year, we would have had those for you this year, and we've delivered them on that. Overall detection is 43%. However, there are still 20% of the total crimes still remain as active investigations. And I am confident that this figure will increase as those investigations progress. You will have the opportunity to challenge us on those figures following my opening remarks. Moving on to traffic. The most obvious is a reduction in traffic prosecutions. That's tickets, arrests, and traffic offense reports. There were 3,139 less traffic prosecutions last year. Although we issued 3,215 speeding tickets, this was a significant drop from 2023 at 31 less prosecutions. 65% of our speeding offenses were in excess of 15 miles per hour, while 51% of the speeding tickets were drivers in excess of 50 miles per hour. And one instance, one driver was recorded and prosecuted for a speed of 103 miles per hour. Again, you are open to challenge us on why there has been a drop on our traffic prosecutions, and we will do our endeavor best to explain why we believe, or what we believe, contributed to the drop. Road traffic collisions. Motor vehicle accidents continue to be a constant and persistent challenge for us, with what seems to be no let-up. There were 3,253 motor vehicle collisions on our roads in 2024, or 62 per week. Although road traffic collisions went up by 1%, it has been on the rise year on year, and I had a look back over 5 years, and every single year that has increased significantly to around an average of 155 road traffic collisions per year over the past 5 years. (9% of the road traffic collisions in 2024 resulted in some form of injury. However, the most notable are those persons who lost their lives on our roads. 14 persons lost their lives on our roads from 11 traffic collisions. That 1.6 mile stretch along Shamrock Road, I think it's commonly called Spot Street, I think most of us will know it, which is the start of Ocean Club to the entrance of Savannah, that area. So 1.6 mile stretch is where we lost 6 persons on our roads last year from 3 motor vehicle collisions. And one vehicle, 3 persons lost their lives. And another vehicle, 2 persons lost their lives. And then 1 person lost their life and another one. So 3 vehicles along that stretch, 6 persons lost their lives. Recognizing this, we did a lot of work to rectify that and mitigate against that situation. And as a result of working, myself as a member of the National Road Safety Committee, we have implemented or installed lane dividers on that entire stretch as a mitigating outcome or mitigating response. Primarily to stop drivers from overtaking. We're all familiar with that stretch, and the reason for the lane dividers was to prevent people from overtaking. The month of December saw 4 persons losing their lives on our roads. It was also the busiest month of policing our roads, with somewhere around 80 road traffic collisions per week. Superintendent Williams here will speak more of that in terms of what we did as far as traffic enforcement and over the year, and I'll give him an opportunity later when we open up the forum for challenge. The issue of road safety is a multifaceted issue, and it requires collaboration with a number of key stakeholders. We play a significant role on enforcement, and I have to accept that. We are held to account when our enforcement is down. We work closely with our partners, and I currently sit on the National Road Safety Committee, as I just said, and we have worked as one team on the committee to make our roads safer, and I gave one example earlier. I will now open a forum for you, the media, and whatever questions you have, please feel free. We'll do our best to answer. And I do ask that there may be certain investigations that we're unable to provide you full, complete details, because those are still very much active investigations. But what I will assure you is that we will do everything we can to provide as much information, details around those active investigations. Thank you again for coming, and the floor is now open to you. I suppose just to reiterate or re-emphasize the point, to my left, Detective Superintendent Peter Lansdowne on the entire crime portfolio. To my right, Superintendent Roger Williams on 2024 would have had traffic policing, community policing, and frontline policing, essentially frontline response. To my left is Inspector Darren Dyer, who would have been acting superintendent over the past month when we would have had some real challenging period for her, and will be in a position to provide you some answers around some of those challenges. So over to you.
Good luck, go first.
I was going to say, can I ask questions on the detection thing? Because obviously that's been my thing, and then I'll leave all the other questions to my colleagues and come back with
whatever you'd like, Wendy.
But given that it's I've harped on about it for 10 years at least. First of all, just to clarify that effectively you're counting detection as from the point when somebody's charged or cautioned. That's pretty much what you're calling a wrap-up case. So even if the charges are dropped, they would be counted in that, just to clarify.
If I can answer all the questions on that. There's a policy we introduced 3 years ago, the crime detection policy and crime counting rules policy. Very, very complicated. It's based on the UK Home Office counting rules, which is probably a 100-page tome of policies and practices. We've reduced that down to about 30 pages. It's still very complex, and we've had challenges breaking it out across every department of RCIPS. So I know you're aware the major crime teams were producing statistics over the last couple of years. I'm pleased this year everybody is on the same page, everybody's adhering to the same policy, and we can publish ethically sound, robust crime detection standards. April asked, what is a crime detection? Yes, in an ideal world it will be charged, cautioned, it will be a court-sanctioned, solved crime.
Okay.
But it also includes where witnesses don't want to go to court and specifically ask for suspects to be warned.
Right.
We would count that. If we can prove somebody is responsible for a crime, it depends, there's different outcomes to it. So the policy gives us 17 different ways of closing crimes. 13 are detected and 3 or 4 are non-detected ways of closing crimes. So it's not just court. That's the ideal answer, but sometimes there's non-sanctioned detections as well. So people that we will hold account for a crime.
Okay, that makes sense. And just to clarify a bit more before I get onto the questions, this is purely detection in 2024.
Yes.
You're not including perhaps crimes that occurred in 2023 that you detected in 2024 ?
No, the analysts are very strict.
So we can be comparative.
There are lags and leads, as the previous commissioners used to talk about. And for instance, we did some analysis. Certainly the UK have rape investigations take on average 400 days to investigate. So you're never going to get a detection in the year that you're investigating. indicating.
Right.
But what we'll do is go back and amend last year's statistics and try and provide comparable statistics year on year.
Fantastic. Okay, so now the questions. The gap between the 63% of crimes that were either detected or still active, what's the status of the other 37%? What does that mean? I'm trying to understand. So you've detected
43%.
43%. You've got 20% active.
Yes.
Ongoing. So that's 37%. That's what?
Closed. The investigation. The investigation's been concluded that we without significant further information, we cannot solve that crime. So the crime is closed.
It's actually documented as either closed because there was no crime or there was no evidence or you can't solve it.
They are crimes. So the first thing is to classify them as a crime. So from 35,000 incidents, 4,000 of those are classified as crimes. Of those crimes, 43% have been solved. 20% are still active, and some will be closed as detected, some will be closed as not detected, and the rest have been closed as non-detected.
So that wouldn't necessarily count going forward in future, just so I can understand these figures as we go through. That would not include cold cases. Because if you're talking about crimes this year and you've made a decision that you can't solve that crime, it wouldn't necessarily be a cold case then.
No, cold cases can be reopened at any time, and in fact any of the closed cases could be reopened. If significant new information came to light, witness came forward and said, I didn't make myself known 2 years ago, but I saw this, we can reopen that crime.
So how would you define it? This is what I'm trying to get at. How would you define it? Like no leads, what makes it closed?
So if I could help, perhaps Peter, what you could do is provide an example. If you look at acquisitive crime, for instance, burglary is obvious, theft from motor vehicles is obvious.
Right.
So let's just say someone is returned home at 7 o'clock at night after working all day, found their home broken into. Police had responded, we've attended, we've done everything as far as the crime scene preservation, looking for evidence, whether that is forensic evidence, trawling, CCTV, whatever that investigative strategy looks like, and we've done everything that we possibly could have done. We've exhausted all lines of inquiries, and we have not gotten any further ahead with detecting that particular burglary. At some point, that closes. So at some point, that closes. It's then properly archived, but it doesn't mean that it's closed in the sense that we'll never open it. We've seen where we've had instances where we've got a fingerprint hit, or we've had a witness come forward, or maybe there's a DNA hit, but again, it gets back to that lagging point. Perhaps that may have been 4, 5, 6 months down the road, so to speak. So I think it's just helpful to understand the context of it.
Yes.
If you look at our burglary figures and you see in terms of a detection, I'm sure you'll talk more about that. But that I think it's helpful just to give you one example. And the simplest, I suppose, example to give is within acquisitive crime.
Yeah. So if it was a burglar who's a serial offender and you get him for 1 or 2, but you suspect he did 6 or 7 others, those are going to be closed because you can't prove it unless he admits it.
Absolutely.
Absolutely, and it happens all the time.
Right. Okay. So serial.
But then, quite possibly, 3 months down the line, he decides he wants to talk to police and admit other crimes, and they can be reopened and reinvestigated and dealt with like that. But I was going to go on, if this is an appropriate time, and explain. We've broken down the crime statistics into crime types, and the reason for that is because different crime types have different solvability factors. Some are far more difficult, and we would expect a lower detection rate than assaults, where you may know domestic violence assaults is almost invariably interfamilial, or you know the person involved, but they have their challenges because quite often the victims don't want to prosecute their partner or the offender. So we may know who the offender is, but it's more difficult to get them to court, so we're more likely to have non-sanctioned detections. A burglary or acquisitive crime, random crimes, you were less likely to know the suspect, we would expect a lower detection rate. We've broken it down into crime types, and I am proud of the statistics. Mr. Walton's pushing me for even more. We will improve, but these statistics are world standard. I did 40 years in London in the Met Police, and we just could not even aspire to these figures. The Met Police in London are detecting 5% of crimes. We're detecting 43. I've tried to compare across territories, and it's very difficult because our policy is very robust and very technical and challenging, and other territories don't apply the same rules as us. So it's trying to compare like for like. But for instance, overseas territories, Gibraltar are detecting 26% of crime, and I'm saying what brilliant statistics that are. St Helena, where I've been, admittedly they only have 150 crimes a year, but they detect 50%. We're getting close to that. I think we will be close to 50% next year. Different crime types, minor violence, as I said, domestic types, 58% detection rate. Serious violence, probably at distance, weapons, maybe they don't know the offender, it's gang related, 38% detection. Sex offences, 33%. Firearms crime, 26%. Firearms enabled crime, which is slightly different. We don't double count, but a robbery or a shooting is firearms enabled crime, but it would count as a robbery, acquisitive crime or something. 18%. Burglary, 28%. Now bear in mind the UK are between 1 and 5% detection rates on burglaries. We are outstanding, and I will give all credit due to our scenes of crimes, our CSI officers, who have done an absolutely sterling job with fingerprints and DNA at crime scenes. They are outstanding. And as Wendy said, recidivist offenders. Undoubtedly, we have sprees of burglars. You can almost plot when certain people come out of prison. There's a spree of burglaries. We might catch them for one. Like, we know they've committed 5, 10, even more. We detect one. So 28% detection rate there is outstanding. Robbery, 12%. We've got room for improvement there. Overall thefts, and I said thefts is pretty random, and not known suspects, 24%. And other crime, which is drugs, weapons, generally victimless crime, but it's police generated. We find these people in the act of committing offences, 47% detection rate. So we are doing extremely well, and it is keeping Cayman safe. So I've got other statistics on crime rates for the Caribbean region and murder rates and things like that. Please publish. We are doing extremely well.
What did you say the murder rate is?
Sorry?
What did you say the murder rate is?
The murder rate. So murder rate is measured per 100,000 population generally.
No, I meant detection.
Oh.
So do you want one second?
Yeah.
Have we got that broken down in the stats? I don't remember seeing it.
Not
so I think
specifically.
all right. So I suppose if we look at it holistically, because I had a look at murders since 2017, and we've had 27 murders since 2017, of which we've thus far detected 20. So that's average about a 75% detection rate, and that's where we're currently at.
Right.
We still have those 4 murders, obviously in 2024. Those are still very much active investigations. But overall, our murder figure is around 75%. I just gave you the actual figure, 27.
Yeah, that's great.
Over the past, since 2017.
I have got questions, but
I would like to move it along now.
Yeah.
Okay. Who would like to go next? Ralph.
Yeah. Yes, okay. My question will be a lot brief. First of all, I want to congratulate you on the new report. I think it's very clear and actually avoided me from having too much questions. Just 2 areas I'd like to touch on. First one is the traffic accidents. As you know, the deaths are not anything that we're proud of. Based on your investigation, would you say that the reason for the accident leaning more towards the ability or the inability to drive properly, or the inexperience of some of our drivers?
So are we speaking in its entirety in terms of the road traffic collisions, or are we speaking in terms of the fatalities? Because what we have found, our findings are that DUI in particular is really the cause of most of our fatals. That's what we're finding. Overall, road traffic collisions, the bulk of those are through inconsiderate driving. So careless driving, essentially, because the bulk of that, those numbers, the 3,253 numbers, are down to your minor type offenses, so to speak. So that's your careless driving, inconsiderate driving, and so forth.
So you're confident with that? The drivers on the road, most of them are capable drivers.
I'm sorry?
So you're confident that the drivers on the road are experienced and
I think that's a different question. That's a second question. Your first question, I want to get this clear, Rob. Your first question was about what we're seeing. My understanding was what we're seeing in terms of some of the causation of the road traffic collision. The second question, whether or not they are capable and qualified drivers, I would say absolutely not. The culture of driving is abject. It's just horrific. The disregard for other road users, and that could be for changing lanes in terms of proper use of your indicators, the improper way in terms of using overtaking, driving too close behind the vehicles, not following the rules of the road, on wet roads, not following the rules there in terms of safe distance behind and what that means over 2 car lengths or behind 1 car length. They just bumper to bumper, that type of driving. That is really what the issue is. So to answer your question, are they qualified? I would argue absolutely not. But they've qualified in the sense that they've gone and sat and passed a roadside test, and I'm sure they've done what they had to do at the time. It's just afterwards the development of bad behavior and the culture on our streets and as far as driving.
That answers the question. The last one, a question regarding the ganja, increasing ganja, increasing drugs. You have just processed a referendum, and the majority have sort of supported the legalization of small amounts of cannabis use. Do you anticipate an increase of the demand? And if so, do you think that there should be some consideration as to how the demand is dealt with, whether we should look at putting laws in place for the supply, or how we should manage the supply?
Yes, my response would be, first of all, recognize there has been a referendum, the people have spoken. That is going to be a national policy. That is beyond me. That is a national policy. However, I am keen to know or keen to be involved in what that looks like. So what are the considerations around, well, what does it look like for policing, and what challenges it present for policing? Is it going to be openly smoked in public parks, for instance, at our public beaches, at our public parks? What does that look like? So what would be permissible for someone to have per day, and how are we as a police service going to monitor what that looks like? So my point there is that's a national policy, but I am keen to know what it's going to look like as far as the considerations as to how that's going to be regulated. As I suppose there's a second part to it in terms of whether or not we think there will be an increase in demand. I think the stats worldwide show that 100% there will be a demand, because no doubt there are people now who would choose not to smoke because of fear of being prosecuted. Perhaps they want to smoke, but once you've decriminalized it, those individuals, I am certain, will know, okay, well, it's okay to smoke now. So I expect there will be an increase in demand.
How do we deal with the demand?
Well, again, it will be in terms of, as far as our enforcement, again, it will be, I will have to look at what the regulations say, what the new act says or the amended act says, and able to police that. I can, obviously I expect some challenges, but that's a policy decision, and hopefully I'm sure I'll be involved in the discussions around that.
That's all for me for now.
Thank you, sir.
Sandra?
Right. Two quick questions. Recidivism coming out of prison. Anyone keeping track of that statistically?
So that's, again, a big national policy. I know it's well within the ministry. I sit on the National Security Council as well as I sit in the National Security as coordinating committee where and one of the things we've looked at there is recidivism. It's a big project. It's not an overnight project, so to speak. So that is a discussion being had within our National Security Council and then allocated to within the Ministry of Home Affairs that's been allocated to, of which I will provide full support around it. I'm a huge fan of addressing this issue, looking at rehabilitation. I think it needs to be done. It needs to look at the issue around recidivism. I think the challenge will be in terms of what does the definition of recidivism look like, and there's a bigger challenge in terms of resettlement. Cayman is a very small place, and generally speaking, persons who go to prison, in particular if you're looking at individuals who are habitual drug users, so to speak, come out and pretty much return to that same environment. So that's a whole discussion in itself as to how the resettlement of persons like that would, I suppose, part of that rehabilitation, because that has to be in the discussion around recidivism.
So we don't have any statistical data on that that's available?
I am not aware of any at the moment, correct.
And then my second question is in relation to police officers having either cameras in, like body cams or cameras in vehicles. Any policy on the horizon for that to make that a reality?
Yes, as the Commissioner of Police, I've pretty much commissioned that, and I handed over to Superintendent Roger Williams, who actually is my project lead for a technology team, a project team we're looking at within our organization, and we talk, and which addresses those issues. So I'll hand it over to John.
All right, so just on the question of technology and in particular body cameras, so we currently have one of our units who is utilizing body cameras full time and have been using it for the past few years. That is policed via their appropriate policy. However, for the wider organization in terms of our frontline response, which is inclusive of the traffic department, community policing, we are just at the back end of trial with another company, and is our intention by year end to roll out fully to the organization a body camera. That will be, obviously we'll have a press briefing on that or a PR on that, and we'll highlight the rights obviously of the citizen as well as the officers and what they're entitled to do. So my intention is, as the Commissioner says, is to bolster us in terms of technology, and that is the direction we are going. And there's a few other projects on the line that I can speak about once we're finished at the end here.
So my position really is to enable Superintendent Williams and the team he's got there in making that happen. I've said we need to advance. It's one of our strategic priorities in terms of modernization of the police service. Technology is the way to go forward. So. And I think it's important for the community as well. They know that when we engage with members of the public, there's a camera there if there's any complaints, public complaints. So, but it's moving ahead, slowly but surely. Yeah.
Okay, thank you.
I did, but I can wait till the end because it's a wrap-up question. If anyone else wanted to go first. Okay. April?
Oh, sure. A couple things. One, I think, perhaps to you, but it might be you. So the information on detection, this detection data, going forward, is this going to be used as kind of a benchmark for us? And I mean, I hate to put crime in a KPI, but is that kind of what the goal will be to help us assess how we're doing as a police service?
Absolutely, it is. Certainly, I'm setting objectives for the detectives to detect certain levels of crime. It's quite ambitious, quite challenging. So that they will be judged against each other and as teams and across the organisation. I know Mr. Walton is trying to push us up towards 60%.
60%.
Which is very, very ambitious.
Well. And thanks for that question. So the issue around performance indicators, I think it's important as a police service to measure what we do. And if you set, would say, realistic targets in terms of our detections. It inspires and motivates our staff to look at their performance, reflect on their investigative abilities, and want to feel proud to detect crime. I speak for my own self when I was a detective on the ground, and my goal, and I suppose I'm trying to have that resonate through the organization, was I have to give my chief superintendent a 60% detection rate on all across crime, whether it was burglary, acquisitive crime, whatever that was. So it's probably a bit unfair, I suppose, because it really is a challenge. It really is a challenge, and there's no UK police force, one of the most modern police services in the world, can achieve that. They've never achieved it. So it's really ambitious. I agree, it's ambitious. But we've still got 20% of active crimes to investigate, and there's still a chance that we could achieve that. I'm confident we potentially will reach the 50% mark. And this is the first year. This is our first year, so we have nothing to benchmark previous to that. And I promise Wendy last year that she will have her detection figures, because you've been speaking about it for years.
Yeah.
So I promise we would have had a policy, a robust policy, and we've got a crime standards, a crime performance standards at the moment in our organization. We meet weekly discussing crime standards, crime performance, and how we're looking. So all of that goes towards what I think is important, and the public demands from us, that when they call us, that they expect us. Not every crime we're going to solve, so I want to be very clear on that. There's no way we can solve every single crime, but at least we do our best. And that's the important bit there for me, that we're doing our best, we're exhausting all avenues, all lines of inquiries, whatever that may look like. Witnesses, CCTV, forensics, I could go on, the list goes on. And I think as long as my officers can leave that victim with the confidence, okay, I feel confident that officer will go away and try to solve my case. That for me is the key.
Yoma.
I've got 3 questions for you.
Sure.
Oh, I'm sorry.
No,
Sure.
Go ahead. I'll come back to you after.
Okay. As we have you here, I think we all are curious. Do you have any update on the Julianne Wiles case that you were willing to share with us at this point?
Okay, we'll hand you over to Inspector Diane Dyer. As I mentioned, Diane was the acting superintendent during that very difficult period, challenging period over the past month and a half.
So for the Julianne Wiles matter, this remains a high priority case. It's still active and ongoing. We have partnered with a lot of local and international forensic experts in order to get to the bottom of what exactly happened to Mrs. Miles. So we have engaged a forensic pathologist, a forensic anthropologist, and a forensic fire investigator. So what I can say is that from our initial forensic evidence, the fire was deliberately set. So we have that indication. However, we are unable to comment further on the investigation at this time, as we are awaiting the final forensic reports. In terms of the investigation itself, we have been reviewing numerous CCTV cameras within the area. So far, we have retrieved CCTV from at least 29 locations, and we are actively reviewing those footages along with witness accounts, forensic evidence as we progress the investigations. So what we are asking the public, and I may just take this opportunity to ask the public for their assistance, we are particularly interested in any information related to a white sedan type motor car with a black hood or black dark colored bonnet that may have been in and around the Lookout Gardens area on the afternoon of April 3rd. So we thank the public for their support and cooperation so far, and it would be really, really helpful if we could get some information around that vehicle.
Can you confirm if this is a murder investigation?
So a formal classification of the investigation will be determined once we have the forensic findings, including the outstanding toxicology and trauma assessments that are ongoing.
So you're still looking at a cause of death at this point from forensic evidence?
Well, cause of death would be a matter for the coroner to decide and speak to the public about, but in terms of hypotheses or theories that we're investigating, it's still an open investigation and we're looking at all investigative avenues.
Okay, thank you for that.
And can I just ask in relation to that, have you detained anyone, even temporarily, questioning around this investigation?
We have spoken to a few persons of interest and we have explored their accounts and we have been able to, they are no longer persons of interest as it relates to this investigation.
My other questions relating to the statistics. The Ed Bush shooting last year obviously drove up the number of attempted murder cases. Can we get an update on that at all? Is that still considered an open case? Is there anything else?
Well, yes, and I think perhaps I should have included this in my opening remarks. The first 6 months of my tenure was very challenging, as you can imagine, and it's why I put it. I put so much emphasis on firearms and neighborhood crimes at the time. Obviously, for us, the 25th of February 2024 was a watershed moment for the Cayman Islands with the shooting at the Ed Bush Stadium in West Bay. And we made a number of arrests. I think we would have published at the time. We have not yet charged anyone. However, following the shooting, we implemented a number of robust policing initiatives, which I must add, I ended up having to reduce or certainly had an impact in certain policing units, including my traffic unit, my community policing unit, to deal with this issue of the scourge of firearms in our community. What I can say as a result of that is, by doing so, led to the recovery of 15 firearms, led to the arrest of a number of individuals who have been incarcerated since. And while we may not have charged anyone, and without going into specifics and details, I am confident that we've arrested persons who were involved for other offenses, such as firearms.
Are they currently incarcerated?
Correct.
Sorry, my third question is, it might be actually connected with this, because the number of traffic summonses went down dramatically last year, and I don't think anybody can argue that our roads are fairly unsafe these days, so people might be very surprised by this drop in the number of traffic summonses. I know you said you took people off the traffic units to help with the Ed Bush situation. Was that an impact? Was that?
Well, we had a number of departments we had to look at to provide to bolster our units out there, providing heightened visibilities and this operation that we're targeting firearm offenders. That's just one, I would argue, one of the reasons. But overall, we've seen a reduction in and that's because of attrition. People have left for other areas, or through promotions. We've had a reduction in our traffic unit. So we're down by, certainly compared to where we were in 2023 as far as the numbers, we're down somewhat, about 38% on where we were in 2023. So that's probably a reflection on that reduction in the number of traffic prosecution. So it sort of mirrors, so 38% less staff in 2024 total of where we were in 2023, similar to our reduction there overall in terms of traffic prosecutions. So it pretty much mirrors that. So that's just one reason. That's just another reason. As well, the issue of road traffic collisions continue, as I mentioned, to become, it removes officers from the streets, those traffic officers from the streets. That takes quite a bit of time to investigate. So those 65 or 62 road traffic collisions that we have per week, it requires significant amount of time as far as an officer sat there completing those investigations. So by the removal of officers immediately, that would have led to that removal. By that, those investigations would have increased in road traffic collisions, would find ourselves less time on the road in terms of speeding traffic prosecutions. The third bit, I suppose, we are having a challenge, and I'm working within our National Road Safety Committee, the challenge around the engineering aspect of the road, as far as speed traps. And there are a number of areas that we are struggling with as where we place our vehicles, because we've had complaints from members of the public that our own cars are parked on the road shoulder, so where you would have pedestrians or you would have cyclists. So we've had to, we accept that. But we are working with our colleagues our partners over at National Roads Authority to look at other ways during the engineering process, during the design and planning of roads, how we can accommodate, I suppose, roadside traps. I think, though, because I need to make it clear that the solution to slowing people down on the roads is not adding more cops. That is one solution. I think the overall solution is when we put speed cameras out there, that's another solution. And we are having that discussion at the moment with, again, that's all within the National Road Safety Committee. So that's another solution. There are just shy of 500 miles of roads in the Cayman Islands. It's difficult to have a police officer on every stretch of our roads. That's a real challenge. So we need to look at other means, and I think that will go towards that driving culture we spoke of earlier, Mr. Lewis. And I think it will go as well to, we'll see an increase in terms of prosecutions. I am looking, and I'm sure a question will come eventually, that I'm looking to increase our traffic this year. There are a number of options we're looking at. One of those is increasing resources, but I don't have anyone right now within existing resources to put in there. In reality, there's only one department right now I could call on, and I don't want to do that, which is my community policing unit. They're already short. And for me to bolster traffic as it is right now today, I would have to literally, to get us back to where we were, I would have to halve community policing. I can't do that. I can if I had to make a radical decision. I don't want to, because we get a lot of complaints from community, and we're saying we are a community-focused, community-led policing service. So we've done a lot of work on what it needs, what it looks like as far as resources in the police service, and I'm sure you're keen to talk about that at some point.
To support that, just to support that as well, it's important that we also mitigate that by also improving the technology. And it was a question asked earlier. So some of the things that we're also doing is we just procured more handheld breathalyzers, and those will be going out to the various units, and that will offset some of the workload for the traffic department that is already on the burden. We also invested heavily in what we call the Black Widow jack stands, which will significantly reduce the on-scene time of RTC's motor vehicle accidents. So the statistics show that average time for a motor vehicle accident in terms of our response and on-scene time is between 1 hour and an hour and 15 minutes. Now, what that means in a lot of those times when we speak to the officers, what they're saying is a lot of that time is especially when we have a damaged vehicle that they can't push from the roadway. So what these will enable us to do is at least temporarily move the vehicle to the side of the road so we can free up the traffic. And it is a delicate balance between, as the Commissioner said, between other priorities, because we could have an officer writing 15 tickets. However, there's one motor vehicle accident that will cause a national gridlock. That is also a priority. Other than that, we're also looking into technology in terms of how can we get the prosecution process quicker. At the moment, we handwrite tickets. So we handwrite over 7,000 tickets annually. Now, for me, we're in the technological age, and I guess that's why Commissioner Walton gave it to me, is we're looking at improving that in terms of handheld devices. We've seen around the region where other countries have started to invest heavily in e-ticketing. So it's in short, your ticket is issued at the side of the road, and within 5 minutes you're able to pay it. So at the moment, we have a manual process where the officer has to handwrite that ticket. Then at the end of the day, he or she then goes back to the station, enter that ticket into an electronic process, which then has another process and later towards the court. So we're partnered with obviously the court and other law enforcement agencies as well, because the RCIPS is just one entity that issues tickets. There are other entities that will benefit from this e-ticketing system. So overall, from a technological perspective, we're looking to bridge that gap, and then that will mitigate some of the issues that we have here and discuss today.
Sure. Mine was, we talked a little bit about the referendum on the decriminalization component, but the National Lottery came up as well, which isn't directly related to police, but I do remember in the discussions that one of the reasons it came about at all was because of concerns about people who were buying numbers and some of the crime associated with that. Any thoughts on the passage of this and how it might affect the work you do?
Again, I think I'll just revert to what I said earlier. It's a national policy decision. It's, I'm keen to see what it looks like. I don't know what the regulations are. It's difficult to speak about, I suppose, a referendum when you don't know what the law or the regulations would look like in terms of those considerations. I'd imagine that, you know, as a police commissioner, I would be asked for some input, and as far as from a policing perspective, I suppose, and I would be certainly keen to provide that. As far as your question around crime and I suppose associated with numbers, yes, we had this discussion now years ago. We provided a full paper on that a few years ago in terms of what we saw around I suppose the lay of the land as regards to gambling at the very moment, which is it's illegal to gamble in the Cayman Islands. So we did provide an analysis around what that looked like, and that was more so in terms of sanctions, in terms of imposition of stricter sanctions. That's really what that was about.
Was there, just a quick question in relation to that, was there any statistical information obtained from other jurisdictions that once they introduced a national lottery, if that had any real impact on the illegal gambling? Because they're very two different things. So there'll be people who will still engage in illegal gambling even if there's a national lottery.
Did I produce?
No, I'm saying, because this is always one of my big question marks around the whole issue, like why push a national lottery if it's not going to impact the issue of illegal gambling?
Honestly, Ms. Catron, I can't answer it because I don't know. I'm not in a position to know whether that was done.
About 10 years now.
I'm so sorry.
That's okay.
My fault, Ms. Hill. I do apologize. I do apologize for that.
I can tell you my husband's more offended than I am.
So the other question, it was more general in nature. Looking, it's been what, a year and a half for you now, so to speak, in terms of your position? Looking at the numbers and the information, what's your perspective on how things are going?
As an organization? So I suppose that is, I had to look at it twofold. I had to look outward in terms of the crime and traffic landscape and the challenges that it presents there for me. And then I need to look inward in terms of, you know, internal issues that I have challenges every single day and trying to manage that. And then the public, because ultimately I want to make sure that the public do not lose as a result. So for me, the biggest challenge I found when I started was the first 6 months for me was about the foreign crimes. We had massive issues there, the gang tensions. I came into this and I made a statement that I was under no illusion the challenges that lay ahead. And I said that for a reason. And within the first 6 months, those challenges presented itself. Because we were aware, it gets back to that whole recidivism, the gang tensions, we saw what was happening there. But we've tackled that head on, and that's not to say everything is done. There's still issues there, underlying issues. That is not completed yet. But the important bit for me is that in tackling those challenges, I have a very good I'm surrounded by a very good support team. And that starts in this panel here. It starts with the rest of the team. So you see me as police commissioner. I put myself up front there. In the back, I've got some really talented people around in the back that I'm sure will be more than happy to provide you more details. But without them, it doesn't happen. And then that spread across the entire organization. I would say we have a good police service, but we want to be great. We have a good police service, but I want us to be great. I am confident we are on that path. As far as traffic, that's a massive traffic for us. I go back to 2008 when we had less traffic on our roads compared to today. The latest figures I had from the director of traffic last week was that we've got 65,000 cars on the roads. That's practically 30 to 40,000 more cars on the roads than where we were back in 2008. So I use 2008 as an example, and that increased with homes in terms of buildings increase. So I say all of that because it presents challenges for policing in terms of acquisitive crime. We're seeing more sort of your communal, your condos, so your parking lots, so which could be targeted by thieves, either on foot, on bicycles, and that no doubt will contribute to an increase in crime. These are some of the challenges that we're faced with. But again, the staff that I have are up for that challenge. When I look internally, the challenge I have is retention of staff. Significant retention issue. So for instance, last year alone, we had 34 people join, but I lost 34. And that's for various reasons, but the most commonly used reason, I suppose, or the common theme was, and I read exit interviews, less work, more pay. So the challenge I have is how do I keep staff on board with us and continue on this journey to try to get to grade. That's the challenge I have. And I am competing against a labor market that are talent spotting our staff. They're talent spotting our staff and they're offering more money. And I'll give two examples without naming the individuals or naming the companies. But I lost two of my staff in a digital forensic hub. One went for double their salary in a private industry. One went for near $20,000 a year within a statutory authority. That's what I'm up against. These were talented people, and that's just one example. I could look across other areas, but I'd rather just, you ask me in terms of how, what do I see? That's where I think the challenges are going to be, looking outward and then on the inside, looking inward. But that's for me to deal with. And I feel confident I'm up for the task. But the important bit there for me is the support that I'm surrounded with. I cannot do this on my own. I've got a good, strong senior command team I'm surrounded by. They're working diligently, very hard every single day to keep this country safe. Got my humble opinion, a very good line management team coming out from my sergeants to my chief inspectors, managing the people on the ground. And the people on the ground, I would argue 99.9% of my staff are good people that genuinely just want to do the job for this country and make our road and make our country safe.
Can I just ask very quickly, $7 million?
I was waiting for you.
Yeah. I just wonder, given what you just said, I'm surprised it wasn't more, but can you break down for us, because we know it was voted for at the last minute, before the election, and obviously it was part of that extra money that's pushed us into deficit. So I just wondered.
I would hold off. No. I would hold off on that. I think it's unfair to say it was part of the money that pushed us into deficit.
Fair enough.
I think that's really unfair to say, without having the full facts of why we're in a deficit. And I don't want to speak. It's not my remit to speak.
Fair enough. Just what was it needed for?
So what I will break that down is twofold, basically. So we have a situation where we have officers across the entire, well, certainly from the lower ranks up to the mid ranks, we have complete salary inequities across. Okay, so to try to resolve that issue, I asked for $1.937 million. And as an example of that, do you think it's right, and I ask you this question across every one of you, and I'm sure the public, do you think it's right for a newly promoted sergeant who has spent months studying for the exam, spent months preparing for the promotion process, is now successful, and that newly promoted sergeant is making $45 a month more than the 8 or 10 constables he or she is supervising? That can't be right. So what I'm trying to do, and that's just one example, like the list.
A month, did you say?
4 or 5.
A month.
Yeah, more than the 8 or 10 constables. So I have to try to rectify that. This is not an issue that started yesterday. This is a long-standing issue that has been ongoing now for 2 previous commissioners tried to rectify it. So I am doing the same thing here, and I'm hoping to rectify that problem once and for all. So that was the $1.937 million I asked for to rectify it. It's not a salary increase, it is a salary equalization project. The other, the other $5.7 million was towards an uplift in our staffing levels. As you heard me say earlier, we are struggling to meet the demands. And that is across all areas. I'm struggling in traffic, I'm struggling in community policing, I'm struggling across the specialist operations, I'm struggling in a number of areas to make sure I've got adequate staffing to provide to people of the Cayman Islands in terms of what I think is required to properly police the Cayman Islands and give us the best opportunity in terms of making our country safe. So that meant an additional 75 staff would be needed to get us to where I think we need to be at, that adequate staffing levels across your uniform front line, across your specialists. So that's the overall building capability and capacity as far as the resources are concerned.
So we can all expect the budget for 26-27 is going to go up significantly, please.
Well,
or at least you're going to be asking for a lot more.
Well, I will certainly be asking, and I must say I'm well supported. I'm well supported by the government, and previous budgets we've been well supported. So this is just to get us to where I think we spent a lot of time. I had a project team looked at this for near 8 months, so it wasn't overnight. This wasn't just we need this amount of money. A lot of deep diving analysis went into it that we produced near 40 pages in terms of what our findings. So within we did that. So when we were ready, we went in with that preparation, that prepared documentation to government, our premier at the time, to say, this is what we think we need to police the Cayman Islands.
Okay.
Which would mean looking into the cost, the full cost of what that looked like. And that's where that money came from, as far as the outlet, yes.
Okay, we're getting close to our hour. I just want to jump up to Sean. He has a question.
Just one question real quick. With the challenges of staff retention and the budget projects, what would you say the department's first or initial move towards the progression of those challenges would be?
You have to start with traffic.
Okay.
That's obvious.
In doing so, I mean, with the two challenges being staff and probably equipment or technology, which one are we attacking first? Which way is the budget going or leaning? Is it more divided, straight down the middle?
Parallel. They're in parallel at the moment. So we're looking at the resource issue, and we're also looking at technology. So that they're going basically side by side.
So the budget project was allocated to parallel them at the same time, not more staff and then more technology after that?
No, absolutely not. Yeah.
Did you see the legislative change, speaking about traffic, of adjusting the blood alcohol level? Has that impacted you in a positive or negative way?
Mr. Williams, would you want to take that on?
Not really.
Bring the mic over close.
I think based on the data, nothing really has changed in terms of the DUI. It's changed from 0.070 previously from 0.100, and what we've seen is that 67% were double the legal limit, and 25% were 3 times or more the legal limit. So in short, what we've seen is that most persons are still hitting well over the 100 as it was previously. So therefore, again, it comes back to also the responsibility of the public and adhering to the education, and we put out consistent PRs, and I'm happy to say we had a very safe Batabano weekend, because I was very fearful of that. But the point is that persons also have a social responsibility to understand that they are responsible at the first instance and be responsible for drinking.
So there is, yes, and absolutely, Williams hit the nail on the head there. There's a personal responsibility from each driver when you get behind the wheel. But I do think the culture of drink driving in this country needs to change, and the only way to change culture is to force it on people. So at the moment, you are convicted for drunk driving, but it doesn't result in a criminal conviction. Is it time, for instance, to start thinking that way, which will impact on your ability to travel? So that's the sort of discussion I intend to have, certainly, and I'm just awaiting for the current government just to get settled. So that's the sort of discussion I want to have in terms of tackling this traffic issue. I think now it's time to education will continue and we'll speak about culture, and drivers need to be more responsible, but now it's time to move on. Said, okay, you're not listening, it's time to force the culture onto you. So if you continue to drink and drive, start looking forward to criminal conviction recorded against you. If you run people over recklessly or dangerously or drunk, should we be looking at a mandatory minimum sentence? So that's the sort of discussion I intend to have. So no different from the Firearms Act, has mandatory minimum sentence for caught in possession of a firearm. Should we be having a discussion around certain types of offenses where you have knocked someone down, killed them, left the scene, or either you're drunk or you've at such a speed that is so reckless and dangerous that you have endangered other road lives. That's the sort of discussion I think needs to be had to change the culture of driving this country. And I say that without any reservation. And I will have those sort of discussions in closed forums. But I'll say it here publicly, that's what I intend to do. It's time to start forcing the culture of our drivers on the streets.
Just on that, have any charges been brought against the hit and run individuals involving the cyclists in the last several weeks?
Yeah, they arrested him.
They were arrested with charges.
So no charges have been laid as yet, the investigation, and we have the traffic leadership here, Inspector Butler, Inspector Tahal, and they'll be able to answer more details after the forum, but no charges has been laid as yet.
Right. One final traffic, Linda and Larry, can we get an update? Has any additional person been arrested and or charged in relation to that road rage incident?
So I'm pleased to say that the investigation was completed a couple of weeks back, and it's now sat with the Office of Director of Public Prosecution. So we're just awaiting the result from that. There's nothing much more I can say at this point. What we've done is what I said at the time, we need to do a thorough investigation. That's now been submitted.
Okay.
And thank you for raising it.
Can I answer here? Yeah, sure. Are there any other questions before we go ahead? I'm kidding. It's not my job. Just thinking back on a number of the questions you just answered, what are the priorities you would like to bring forward to the new administration as they have come in? I know that they are quite eager to get the ball rolling. So if you had to list your top 3 priorities, outside of traffic, obviously, for them to address and to give you support for, what would those be?
Well, we work in 6 top, big strategic priorities. Now, obviously, making our roads safe is a big one for me, and I just spoke about that. I do think that prevention and tackling crime is critical in our country, and we've been doing that. I do think that right now the whole issue, we spoke of sexual crimes and the impact on children and the issues around, or the impact on protecting our vulnerable, so protecting those persons at risk, vulnerable at risk. I think those are really, for me, 3 key priorities, and we're doing stuff already around it. So I've Superintendent Richard Barrow, Detective Superintendent Richard Barrow, if you feel afterwards, now leads the multi-agency safeguarding hub, for instance, and we're looking at all the big topical issues there in terms of child safeguarding, domestic violence. We're looking at, we've got Inspector Anderson over there, capable detective inspector that is on the ground managing that. But in addition to that, I'm bringing in a detective chief inspector who was previously in the Met to look at all these big issues to make sure that, because we know that we've just recently had amendment to the Children Act. That for me is key. Protecting the most vulnerable, our children, and some of the issues that we see with children in this country, and just do what we need to do our part in that protection. The big issue around prevention and tackling crime, what we're doing holistically as a country in terms of pulling all the key stakeholders around the table so that we can look at the issues around gang tensions and those young individuals who get themselves involved in criminal activity or gang activity. Why is that happening? So how can I contribute to that? But that is not a policing issue alone. That's a broader issue of which we contribute to. I'm 100% behind that and support that. Making our roads safe right now, if I look at threat, risk, and harm, what poses the biggest threat, risk, and harm? Has to be our roads. It has to be our roads. And to tackle that, no need for me to repeat myself, that issue of changing the culture on our roads. So we need to have a discussion in terms of, do we need to look at amended legislation, resources, the technology. So I see road safety as a big component part of this. Community policing, well, we just get constant calls coming in about issues in the community. We try to address every single issue. It's a challenge, the demand's coming in, and it's constantly issues that are not only police issues, but we tackle them. We tackle these issues. So, but we work with partners. So we work with our DEH partners, we work with all of our other partners to try to tackle some of these issues, whether they're immigration, whether persons are here illegal, person working without permits, person overstaying. And you would have seen some of those joint operations, certainly this year, Week of Action, and previously Mr. Williams has been heavily engaged in all of that in trying to assisting our partners in that. So to recap, big 3 for me, making our roads safe, and that has a whole list of anchors or areas to look at. Prevention and tackling crime and protecting vulnerable and at-risk people. That's really what I see the big 3.
Thank you very much.
Yeah.
Okay. Unless there's any more burning questions, I think we'll try to wrap it up there. No?
I just have one, Tanya, because it's about the community policing and why it's important. Because would you say that as you've improved community policing over the years, because decades ago so we didn't really have much, but do you see that assisting with the problem that you have of the communication in communities? So when you're dealing with a crime like the Ed Bush thing, that trust is very important. Where does community community policing come in terms of encouraging that trust?
I mean, I'll allow Superintendent Williams in a second, but I think certainly as a police commissioner, we cannot operate in this small environment, this small community without community policing. For me, community policing is at the heart and soul of everything we do. We cannot and we should not function without it. It has to be at the forefront. I'll give you an example. When I was a detective sergeant in 1999, I'll give you one example. Even though community policing had just recently started, so it wasn't at its full, I suppose, roll out. But I had a really good, even though I was not a community police officer, I had a really good community, established that community contact within the district I was working, where I knew pretty much every criminal, everyone in the areas. What that did for me is that when we had a significant issue, which was a shooting, within 48 hours, I was able to identify the 3 suspects, arrested all 3, recovered a gun, and charged 3 individuals by having that contact within the community. Because you know why? They trusted the individual, and the individuals trusted me. And all they said was, Mr. Walton, you need to look at this. Look at these individuals. I'll say no more about that, other than to say that's just one example of the importance of community policing. Where I think we need to do is we need to refresh community policing. And I have a view, and Mr. Williams on what that view look like. My Assistant Commissioner of Police, who's not here today because he's overseas attending the Association of Caribbean Commissioners Police conference this weekend on my behalf, knows is driving that, will be driving that for me. But we need to refresh community policing so that I think there's a misunderstanding of what community policing is. And community policing for me is understanding the issues that are bothering, are posing problems for those communities. There should be no community police officer that don't know every single criminal and on their respective beat. There should be none. So we'll be looking at refreshing our community policing program. That will entail, obviously, I need to increase the levels in there as far as resources, as well as I need to look at the training for the staff. And so to answer your question, we cannot function without community policing. We need it in this community. And Mr. Williams?
Yeah, no, I think you've added adequately there, sir. But yeah, every time there's a major incident, community policing is often relied on because they are the conduit within the community, and especially the community that crime is impacted. But I just wanted a moment just to thank all our partners, because you'd have seen a lot of collaboration last year between our partners, and I just have to thank them. I take this moment, DPSC, CBC, Work, DOE, DOA, DCI, because we have had some successes. There's a few PRs that you would have seen that have gone out in us netting illegal workers, overstayers, persons that were wanted both locally and perhaps regionally. And you'll remember that famous one with the guy hiding on the roof. All of that was via your community police officers and leading that charge. But there's also community initiatives in terms of business WhatsApp groups, establishing homeowners association meetings for new communities, and also assisting with the removal of derelict vehicles. I was reviewing the email just yesterday, and we assisted with over 18 derelict vehicles in one instance, along with the DEH colleagues as well. So in addition, the youth is also very important, particularly personal to me, and we have had a lot of success in attending Youth Success Conference, which was held last year, career fairs, cleaning up at various addresses. We attended sports days for the various high schools. Those are community police officers that are engaging. And obviously when we do have our events, and I'll just take the time as well to remind that we did have Police Week for the first time in 28 years last year, and a big driver for Police Week last year for me was engaged in the community, and we had a basketball game, we had a cricket match, not only here as well, but within Cayman Brac, and we had a display as well in terms of police resources. So the point being is that community policing, as the Commissioner says, must engage, and it's engaging through all facets. And as I hand over to Superintendent Seals, who's not here today, he will no doubt continue that journey.
Okay, I think that's a nice place to wrap up. So thank you, Commissioner, and thank you to our panel for your time today and answering the questions, and thank you to the media for attending. As I mentioned, we've got other staff in the room here, so feel free to stay back and have conversations with them as well if you've got further questions. Thank you.
Thank you.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels and visit CaymanMarlRoad.com for all the latest news and community happenings.